to the National Safety Symposium. My name is Joy Mukisa, and let's have ourselves in prayer. Kind and loving Father, we thank you for this day. We thank you for the opportunity that you have given us to be here and deliberate upon a very important matter of national importance, the safety of our roads. Father, we ask that you will guide us as we go about this, and we pray at the end of this symposium we shall have clear action plans and we shall be taking later steps to the safety of our roads and for all Ugandans in general. We ask that you come and be with us. In your name we have prayed. Amen.
Thank you very much, Joy. I request that we all rise and play the anthems, sing the national anthem, so this function can officially start. The anthems. Really is to put you, the stakeholders, together to foster constructive dialogue and talk about the actionable points to enhance the country's road safety. So this symposium will, of course, be able to, at the end, unite all of us, the contributors, stakeholders in this field, to exchange insights and also devise strategies and mutually learn ways on how to enhance road safety. So you're welcome, and I want to invite Chemongesi Timothy from SEPA to give us welcoming remarks.
A good morning to us. Good morning once more. Ladies and gentlemen, thank you so much for honoring our invitation and also accepting to be part of this symposium. My name is Chemongesi Timothy. I serve as the Associate Director at the Center for Policy Analysis. First, I should be able to appreciate us for the good work that we are doing to contribute towards reducing the road crashes and the fatalities in our roads. Your presence here is a confirmation that there is commitment, but also there is a goodwill to ensure that our good cause, to ensure that our support to the Ministry of Work and the government broadly will realize the targets that we've set. As Center for Policy Analysis, we are glad and very excited to continue providing spaces, providing analysis, and also the technical support to the different entities, and primarily, of course, government, to ensuring that we have proper legal framework, but also supporting the different entities as far as implementation of these policies are concerned. I want to recognize the representation from Ministry of Works by the Commissioner. You're most welcome, and thank you so much for accepting our invitation. Representation from Parliament, Honorable Hurunda Alex, thank you so much for accepting our invitation and for being part of today's session. The representation from Rosako, Chair, you're most welcome, and thank you so much for the different entities being present here, the police. Thank you so much, the academia and everyone. Today's symposium definitely is to rethink, but also work towards revolutionizing the road safety situation. And our commitment is to ensure that the targets that we've set at the national level, but also working with the different stakeholders at all levels, we get to realize these targets. Ladies and gentlemen, thank you so much once more for accepting our invitation and for being part of this symposium. And we hope that at the end of the symposium, this can be part of the other efforts that have been put in place to ensure that we work very hard to realize the targets. We definitely head into the festive season, and this season is usually characterized by crashes and fatalities. And we think that through these platforms and the different commitments that those that are charged with this mandate, we can continue reaffirming, but also working deliberately towards ensuring that we realize our goals. Once more, thank you so much, and welcome to today's session. Thank you so much.
Thank you for recognizing our partners, of course, the Ministry of Works and Transport, Office of the Prime Minister, the SDG Secretariat, and of course, ROSACO. Allow me at this point to invite the chairperson of ROSACO, Fred Tumwine, to give us his remarks. You're welcome.
Good morning, everybody. Our distinguished guests, honorable members of Parliament, government officials, CEOs, ladies and gentlemen. Let me take this opportunity to welcome you. As ROSACO, we welcome you to this Road Safety Symposium, and we take this opportunity to welcome you for this noble cause, because we know road safety is everybody's responsibility, and when we get people like you, we hope shall go a lot of kilometers ahead in promoting road safety. I'm Tumwine Fred, the chair of ROSACO, and also the executive director of Uganda Road Accident Reduction Network Organization. ROSACO is a representative of CEOs, and currently we are 22 members, and it started in 2021, formerly by 5 CEOs, which were grantees of GRSP. But from that, we expanded, and now we are 22 members, and we are to go more than that, and we expect next year shall be around 30 or 40. ROSACO's vision is to be a leading umbrella organization in championing road safety in Uganda, and it's our mission. Our mission is promoting road safety environment through research, advocacy, and dialogue with key stakeholders. Why road safety? Facts we have currently is that we lose 4,534 people per year in road crashes, which is translated into 12 people dying every day. And those are recorded information. But if you consider information from, for example, from the Ministry of Health, the number is higher than that. 43% of people who die are mainly young people, and these are productive people, mainly motorcyclists and passengers. We lose 5% of our GDP, which is approximately 7.39 trillion. We are here for a cause, and I think our contributions towards improving the situation is desirable. ROSACO's achievement, since we started, I mentioned that we started in 2021, but when we started, we were emphasizing on policy advocacy. So far, ROSACO members have successfully worked with the Ministry of Works, legislators and other stakeholders on review updates and road safety regulation post-2020 amendment. We supported the government, mainly Ministry of Works, to to improve and strengthen the policies and registrations. The members have proactively worked with the Uganda Bureau of Standards to improve the standards of regulations. We have directly engaged with and training the recipients of critical road users, especially grassroots actors, especially boarders and drivers. We have also trained media personnel. RUSACO members have contributed to enhancing the capacity of Uganda journalists to report on road safety policy. We have also trained 45 journalists who have been trained to report on road safety effectively. The journalists who were trained go up to 57. This year, the training program targets a total of 40 editors from newsrooms across Uganda. Road safety in schools. RUSACO members have worked with schools to a total of 200 schools within Kampala and outside Kampala for road safety education, and we have also empowered children in terms of road safety clubs, and we have also trained teachers to the tune of 300,000 teachers, and we have also established road safety clubs in those primary schools. We have also moved along to prevent road crashes and being implemented by development partners through CSOs. RUSACO members have engaged Member of Parliament for increased budget. I'm happy to mention that our current budget is up to 5 billion, courtesy of RUSACO and other stakeholders to increase the budget for road safety. With the increase of here, the increase is on paper, but we want to be actualized. And if I can mention this, we want Parliament, specialized government, executive, so that the budget we passed should go to the ground, and we implement our road safety. For example, our National Road Safety Action Plan is there. We have moved some years. We have not done much, so we want this budget to finance the activities. We have also carried out road safety campaigns involving boarders, drivers, and we also participate in road safety weeks, global road safety weeks, World Day of Remembrance. All those aim at educating the public on road safety. RUSACO has also done some research publication, and currently we have an ongoing research which is to establish the cause of road accidents in Uganda. What next? We request the government for real-time disbursement of budget allocation for road safety initiatives. All along we have been engaging with the Ministry of Works that the National Road Safety Action Plan was put in place. What next? So we want the government to make sure that it allocates the budget immediately. There is also creation of an interministerial committee to address road safety across all sectors. In RUSACO, we are saying Ministry of Works and Transport, I mean, road safety is a big task that the Ministry of Works should be supported by other ministries so that the interministerial committee can address the safety in all sectors. On the implementation of road safety action plan, we urge the government that this road safety action plan can improve the road safety situation when it is implemented. And so far, we have gone 2 years. We are remaining with 2 years and a half. And within that period, please, we want the action plan to be implemented. Then we also advocate for creation of specialized courts to handle traffic offenders to deal with issues of impunity. Gambano ogu nebindi. Creation of balance between software and hardware, especially with the ministries and agencies of government. When we say that road safety should be worked on, especially on infrastructure development projects, they say, hey, we have done it because they have made road signs and the rest. But we are emphasizing that we should have the soft copy, the software and also the hardware to make sure that the two result into road safety. We are also, the government should also consider investing in road safety, cost-benefit analysis of handling road safety initiatives. I have mentioned that we lose nearly 7 trillion. So what do we, if you consider the impact of measure designed to assess whether the advantages, benefits compared to the disadvantages, there we can come up with an investment policy that let us invest at least half of the money or a quarter of the money. If we can invest, for example, 1 trillion in road safety, at least we can save 7 trillion. Otherwise, thank you, road, and I wish you the best.
And now I want to invite Onesimus Kansime, who is from the SDG Secretariat, Office of the Prime Minister, to give us his brief remarks on Uganda's progress in achieving the SDGs concerning road safety. Onesimus, you're welcome.
Good morning. Standing on existing protocols, my name is Onesimus Kansime. I'm from the SDG Secretariat in the Office of the Prime Minister. Transport has goals that are directly related and are specific to it in the 17 Sustainable Development Goals. And as a country, we have been doing a lot since 2015, ever since the SDGs were adopted after the expiry of the Millennium Development Goals. And one of those things that we have been able to do as a country is put up a coordination framework where all the Sustainable Development Goals can be coordinated and implemented. Our role as the SDG Secretariat is coordinate the implementation of these SDGs. If you look at Article 108A of Uganda's Constitution, the Office of the Prime Minister is mandated with the coordination of government policies and programs. And through that, we also coordinate the implementation of the SDGs, including goals which are related to transport. And one of them is goal number 9 on infrastructure, industry, and innovation. The other, which is related but not specific, is goal number 3 on good health and well-being. And of course the other, because we are now in the city, we are looking at sustainable cities and communities. We have been reporting on these three goals. So far, we are going to release our third SDG progress report, and we have been collecting data on their implementation through the Uganda Bureau of Statistics under the Technical Working Group on Data. And on SDG 9, we have specific targets relating to to transport, and one is 9.2, which is on the upgrade of infrastructure to make them sustainable, and also facilitating sustainable and resilient infrastructure development in developing countries, and also the achievements on some of these goals. If you look at 9.1.2 and look at the passenger and freight volumes by mode of transport, we see that the number of air traffic passengers has been increasing steadily from 1.5 million in 2015 when these SDGs were adopted to 1.94 million in 2018. These are 3 years ago, and I hope that since we had our Uganda Airlines, the number of traffic passengers using air transport has also increased. Air traffic cargo has also increased during the same period. The number of air traffic passengers and cargo has generally increased over the years, which indicates a growth in the aviation sector. But we know that we had an outbreak of COVID-19 in 2020, which led to a significant reduction in air travel from 2.01 million in 2019 to 0.62 million in 2020. But of course, subsequently, this increased to 0.78 million in 2021. Similarly, when we look at the railway travel, which in the year 2021 was 0.62 million, and in 2020, because of COVID-19, we moved to 0.20 million in 2020. Of course, subsequently, we improved in 2021 to 0.81 million. And then we look at the rural population. If you look at 9.1.1, that's in the indicator on SDG goal 9, indicator 9.1.1 on the proportion of rural population who live within 2 kilometers of an all-season road. The proportion of the rural population living within 2 kilometers of an all-season road was 53% in 2020, and the performance of the road transport in terms of quality involves the examination of the length of the road networks, which is of course expressed in kilometers. The total national road length increased by 0.02% in 2020, increased by 0.02 kilometers in 2020, from of course 16.18 kilometers in 2019 to 21,021 kilometers in the year 2020. And during the same period, there was an increase in the total paved road length by 3.6%. In terms of the quality of the road transport, this, of course, which was measured by 1, the share of the paved roads in total road network, and 2, road condition based on classification by International Roughness Index, IRI, as poor, fair, and good. The condition of the paved roads in good, fair, and poor status in June 2021 stood at 4,220 kilometers, 861 kilometers, and 177 kilometers, respectively. And of course, Uganda, to achieve these sustainable development goals targets, especially goal number 9, as the Office of the Prime Minister, we are engaging the ministries that are in charge of this program as per the NDP3. You know, we have 18 program areas, and through that we engage priorities to make sure that in their priorities they are prioritizing the achievement of the SDGs. These sustainable development goals are not being achieved alone as sustainable development goals, but we are mainstreaming them and aligning them to the NDP3. If you look at the NDP3 now, the NDP3 is 90% aligned to the Sustainable Development Goals and 95% aligned to the Agenda 2063. We hope that some of the things that have not been achieved in this third National Development Plan, we are coming up with a mainstreaming guide to make sure that all the Sustainable Development Goals, including goal number 9 on infrastructure, industry and innovation, goal number 3 on good health and well-being, and also goal number 11 on sustainable cities are mainstreamed in the National Development Plan 4. We hope that in the next cycle of implementation, of course, when you look at the midterm review of the NDP3, a lot has not been achieved. Only 17% of the indicators of the NDP3 have been reported on. That means that we have really not achieved so much, including the indicators on road safety. And even when it comes to data, we do not have enough data on some of the indicators on goal number 9. We have challenges on data, and some of the things that we have done is to ensure that in the next national census, all the indicators, including those on goal number 9, are incorporated within the census tool to make sure that we have all the related data that we may need to report on these sustainable development goals. The other, of course, one of the other challenges that may be facing or the implementation that may be affecting the implementation of Sustainable Development Goal 9 is financing. And as a government, to achieve these Sustainable Development Goals, we have adopted the Integrated National Financing Framework. We are also improving on our domestic resource mobilization so that we have enough funds to finance the accelerated delivery on these Sustainable Development Goals. The other thing is, of course, on partnership, which is goal 17, again responding to making sure that we have enough finances to achieve these Sustainable Development Goals, including Sustainable Development Goal number 9, is that we are engaging partners. Of course, we have the 5 Ps, the 5 Ps of sustainable development, which is we the people, the planet, making sure it is protected, making sure that we achieve prosperity and peace, and the other one is partnership, which is goal 17. We are engaging our partners to make sure that there is enough financing for these sustainable development goals. And more so on that, we making sure that the National Partnership Strategy of 2014 is revived and implemented to make sure that these development partners, including the World Bank, the United Nations, the private sector itself, and civil society organizations are deeply engaged in the implementation of these Sustainable Development Goals. As it stands right now, of course, we now stand at 55% as per last year's report on the Sustainable Development Goals, which now puts us as a nation at a higher mark compared to the 33.8% we achieved in the former agenda of the Millennium Development Goals. So we hope that remaining with these 7.5 years, because 2013 up to 2030, we only have 7 years, and that means we are midway the Sustainable Development Goals. We are ensuring that we do not continue to make to do business as usual, because at the moment we are coming up with a Sustainable Development Goals report, which is going to show us how we are performing as a country on each Sustainable Development Goal. And from that, we should be able to get recommendations on what we should be doing to end poverty, on goal number 2 to ensure that there is no hunger, on goal number 3 to ensure good health and well-being, and so many other goals. So at the end of the day, we have economic growth, we have social inclusion, we have environmental sustainability. And also on all these goals, we are engaging local actors. Even on goal number 9 on infrastructure, innovation and industry, we are engaging the local structures because we believe that the implementation of these sustainable development goals involves the primary service delivery is done by local governments. And therefore, we need to engage them, one, to be aware about these sustainable development goals, including goal number 9, and also to be conscious to take action. As individuals, we also would need to engage individual citizens as well to take action. Because at the end of the day, when an individual is aware that they need to be safe on the road and they are conscious about it, they are going to take action and make sure that this is implemented. The other thing we are doing at the local government level is making sure, because we lack data, we lack reporting, so we are engaging the local governments to do voluntary local reviews, to do self-assessments on how they are performing on all the sustainable development goals. So through these voluntary local reviews, we should be able to know how these local governments are performing on goal number 1 up to goal 17. And of course, some local governments have done these voluntary local reviews and has been of benefit. Last year in 2019, Ngola district did voluntary local reviews. And I think when you review the performance of local government, because they used these voluntary local reviews to come up with their district development plan, they are performing so well. So we also are encouraging all the local governments, and I'm now telling this to the MDs, the ministries in the house, because you always engage these local governments on a daily. So we need to engage them to make sure they do a self-assessment and reprioritize for the next development plan for. Because when they are able to know where they are performing well and where they are not, then they are able to plan more efficiently and make sure that these things which have been planned for very efficiently are planned in the next phase of implementation. So as the SDG Secretariat in the Office of the Prime Minister, we continue to pledge to be the convergence center of the Sustainable Development Goals, to continue to monitor and report on the Sustainable Development Goals, to coordinate the implementation of the Sustainable Development Goals, which we are already doing through the coordination of the ministries, departments, and agencies, through the technical working groups that are already existing, the private sector, and the civil society organizations that we are engaging under the CSO SDG Core Reference Group on the SDGs. And we call upon everyone in their daily work, all these partners, to continuously focus on the implementation of some of these targets that are embedded within the Sustainable Development Goals. I thank you so much.
I want to invite the Honourable Member of Parliament, Alex Ruhunda for Porto City, who is also the chairperson of the Parliament Forum on Road Safety, to give us his remarks.
Thank you very much, MC. Good morning. Once again, I'm happy to be here. And I usually joke that this is a fellowship. So whenever I want to pray, I look for road safety conventions, because I know we are talking about saving lives. And for me, you better save the life than praying for the lost life. So I have that belief, but I know that the Europeans prepared us to invest in the life after death than when we are here on the planet. So many of our people, they attach too much value to the life after death. And that's why we have a crisis, because we fail to manage ourselves properly when we are on this planet. And actually we consume very little, because we think we shall eat a lot of stuff when we have died. So you can imagine when you are having such a mindset, and when we talk about death, some people, they don't fear. They think it is God's plan for an accident to occur. They think it is God's plan. And they say God takes the best. So when someone dies, they say, oh, God has really taken this good soul. I don't know for us who are left whether we are terrible, but that is what happens. So to me, when we are talking about policies, rules, regulations, it all comes to the self-discipline and realization of why laws have to be in place. So I've always told people, why do states make laws? Because without the laws in place, then we have a lawlessness society that is very difficult to manage. And of course, our stay on the planet would be very limited. So the first thing is to appreciate the laws. So we can make all these good laws, which we have done, because we have amended the traffic laws. We have now an amended one with very good provisions, including penalties and many other things. But how do Ugandans appreciate that? That is the fundamental question. How are we appreciating the importance of these laws? So for me, it is a campaign that we must really push, because when we come here and we are not tackling the behavioral issues of our people on roads, then it is wastage of time. I have been fighting with I think right now I'm like a traffic officer when I'm on the roads. Every time I'm ringing Nwabine. This one is overtaking in the corner. This one is overloaded. This one is, you can really have headache. I sympathize with our officers. We have a society that has very less regard. They look at these laws as inconvenience, and yet these laws are meant to protect their lives. So we have a big campaign to do, and I even see it here in Kampala. Even this morning as I was coming, people are impatient. They have to inconvenience you. They have to go block other incoming traffic. You know very well that our roads, they don't have provision for the incoming and outgoing lanes. So now you can imagine the confusion. Because of the mistakes of a few individuals who are in a hurry, more than others, you have to be delayed for a whole 1 or 2 hours just because of the actions of others who are impatient. So how do we tackle that behavior? If you really think you want to reach your destination earlier, why can't you keep time? Why don't you budget ahead? So this is the mind-boggling issues which I find very disturbing. Because until we make our people appreciate the common good, they must get to know the importance of living together. Everybody matters. So the leadership has really caused a big problem. Whether it is the commissioner, I'm sorry, my friend, whether it is a minister, you find all this noise, the pollution that is being made in our city. It's as if we have so many patients who are running to go to work their patients. Sirens. Sirens means ambulance needs you to give way for a patient. But can you imagine we have sick individuals who are in these offices? Because the fact they put on a siren for you to clear traffic, it means you are sick. You are mentally sick. Because you have no understanding of the damage you are causing to the others. And you've got this entitlementalism, thinking that you are the most special Ugandan and all the other Ugandans don't matter. Because for you, you must be given way. What type of signals are we sending to others? Of course, others will follow suit. So, if we who are in leadership cannot respect the laws, how do you expect the other people to do so? So it is a crisis. So whoever, unfortunately here I'm not talking to, but I raise these matters even in Parliament. We debate on these matters. Everywhere where I get an opportunity to tell people who think they matter more than others, I tell them. So until we institute discipline in our country, because the more you get elevated in an office, the more you must lead by example. So we must really create a new culture, and we must condemn. We shouldn't glorify people who are breaking laws because they think they are in big offices. The laws are very clear. To know who is entitled, just a few, because it's rare when the president moves around, inconveniencing people around. That's rare. When a speaker of parliament, it is rare. When a chief justice, that's a rare occasion. But now everybody, including a minister of state, I think, and you know how big our cabinet is. So what is this we are causing? So I think it is important, you civil society, you must condemn these wrong practices, because it is not helpful if we sit down and just say the big person has passed. For us, the small ones, what can we do? No, this is our country. So we need to have a bigger campaign. And for me, I keep this message everywhere, because it is important that we respect the laws that we put in place. So I was privileged to host the African Legislative Convention at Munyonyo, and because of our efforts as Parliamentary Forum for Road Safety in Uganda, we are providing more best practices to other parliaments. They are learning from us. I was in Angola and I was shocked. The legislatures, they told me that road accidents, #2 cause of death in Angola. So there are other countries actually where these issues of road accidents, they are not taken seriously. But here in Uganda, I want to give credit that much as we have continued with our bad behavior, but we have made noise and made road safety visible. So whoever is breaking it, they break it well knowing. I think that is an advantage. So we can improve and provide the best example. So we shall go ahead, because I have been following. When we increase the budget, is this money being released? You can have it in the budget and it remains on paper. So part of our role is to ensure that we follow. So I have been following. Why didn't they release the last quarter? I want to see what is released in this quarter. And I want to see what this money is doing, such that we are able to improve our situation. So for me, I believe in you must be solution driven. Wherever you are, you've got to solve a problem. You don't have to make noise about it. So I look for solutions. And we have also localized in our region in Fort Portal. We have got the Bishop Kyalgonza Trust, which is as a result of that bishop who died on the road. And we are leading a lot of campaigns, local campaigns. So using the local media and so forth. So this is the spirit which we should encourage everywhere. Wherever we go, we encourage that. We have also brought on board the Speaker and the Deputy Speaker of Parliament. They are now ambassadors of road safety, including convening meetings in the boardroom of the Speaker, getting all the ministries concerned to see and monitor how far we are able to ensure that our people do not die on the roads. So we must reduce these accidents. So I thank the organizers, SEPA, for getting us this morning to reflect and look at the way forward. We have a long day today. I wish you good deliberations, and I invite the commissioner who is representing the minister to come and deliver the minister's message. Thank you for your kind attention.
Thank you, Honorable Ruhunda. Thank you, Kanale. Honorable Ruhunda, who is a member of parliament, I want to thank you for inviting me, and I didn't want to break the protocol. Protocol demands that I should be the one inviting Honorable Ruhunda, but because the minister delegated me to give a speech, I think I also stole this opportunity so that he can invite me. So thank you very much, Honorable Ruhunda. Senior government officials, I want to take the opportunity to introduce my staff. It is my habit to introduce my staff in the ministry. Please stand up for recognition. Ministry of Works and Transport, yes. So they will be presenting at different levels. Leadership and staff of SEPA, civil society organizations, development partners, distinguished invited guests, members of the press, ladies and gentlemen. My name is Katshabe Winston. I am the Commissioner, Transport Regulation and Safety in the Ministry of Works and Transport. And as I was just arriving at the media center, the NBS house, the minister called me. We had an urgent call from State House. You are aware we have non-aligned movement next year, so most of our political leadership are now busy. They are with the president. I think today there is a visit in Kampala and the airport, so he couldn't be here, but he had wanted to be with you, and I bring greetings from Ministry of Works and Transport. Before I read the speech of the minister, you know, when we have these meetings, it is important also to correct our language. Did I see Canary here? Canary, since you are a state-of-the-art MC, and since you are one of the best news anchors, I think, in the country, I have heard a number of common mistakes, people saying all protocols observed. I think that is wrong English. You know, it's like now I have greeted you, then later I said, oh, I have also seen so and so, I had forgotten you. So you just mentioned protocol, finish, and move to your speech. I thought I should mention that because that is important. I have had that common mistake. Don't, please, that's a misplaced phrase. Don't even if you are attempting to say it today, stop it. Let me go to the speech of the minister. Again, before I read this speech, I should also thank SEPA because they had invited me actually to make another presentation. So because the minister now delegated me to read his speech, we are flexible. So I elevated Sachi. Robert, where are you? So Sachi will now talk about policy and legal framework in the country for Ministry of Works and Transport. So for now, he will have that verbal instrument as acting commissioner as I read the speech. Number 2 or 4, Sepa, when you sent me this invitation, you know I have not been around. I lost my mother. So I found the invitation in the office, but I tried as much as possible to work with my team to have that presentation. Good enough, research has been very instrumental in that. And I want to thank all of you who traveled to Bushenyi to join me to see her off. So let me read this speech of the minister. It gives me great pleasure and honor to participate at this National Symposium for Road Safety. I would like to appreciate Center for Policy Analysis together with your partners for organizing this symposium. This is a good platform to enable stakeholders to discuss ways of improving road safety in Uganda. Road crashes in Uganda remain one of the leading causes of death among the young people below the age of 25. I'm sure the panel will talk more about this. And as rightly put by SEPA in the concept note to this symposium, Uganda loses over 4.4 trillion shillings, representing 5% of our national GDP, to road crash injuries and death. The statistics from Uganda Police reports show that road crashes keep increasing, and yet we have a target of reducing the number of road crash deaths by 50% in the year 2030. It is therefore important to have such engagements to find ways of changing the narrative. As a lead agency for road safety, the Ministry of Works and Transport developed the National Road Safety Action Plan in consultation with key stakeholders, including Rosaku, where SEPA is a member. And we want to congratulate Rosaku. Let's give them a round of applause, please. This plan took a collaborative approach by encouraging all stakeholders to give views that could help in the reduction of road crashes in Uganda. I'm therefore happy that this symposium was organized to bring together stakeholders from different ministries, departments, and agencies with the aim of professionalizing the road safety situation in Uganda. I have seen Maria from Ministry of Health. I hope, Maria, you will tell us more about what we expect from World Health Organization, and we should be able. Jamaima from KCCA should also tell us more. We are dealing with the city now that is the face of the country. Promotion of road safety is a shared responsibility between system designers and road users to move towards a world free from road traffic fatalities and serious injuries. Addressing road safety demands multi-stakeholder collaboration among the public and private sectors. Academia, I've seen Makerere University here, professionals, professional organizations, non-government organizations, the media, among others. The second UN Decade of Action for Road Safety and the Global Action Plan emphasize the need for synergy and collaboration among all stakeholders as a means of achieving the set targets, which I had already mentioned. Uganda is performing well so far in this area, and this symposium is a proof of the synergy towards improving road safety. I therefore commend all of you, civil society organizations, for the good working relationship, and also encourage you to keep up the good work. Like the African proverb goes, if you want to go fast, go alone. And if you want to go far, you go together. So this collaboration and partnership will enable Uganda to go a long way in reducing these road crashes. I would like to report that we have been able to build a good relationship as far as road safety is concerned with the key stakeholders, especially the civil society organizations under the Road Safety Advocacy Coalition, ROSACO, which I have already commended. ROSACO has also encouraged the ministry and indeed other MDAs to be accountable and working to improve the situation in our roads. So I request you CSOs to continue working together, because that is the only way we shall achieve our targets. Last but not least, we still have a huge task of road safety sensitization to all Ugandans, and I request you CSOs to continue supporting the government so that the road safety message reaches everyone in the country to change the road user risk behaviors. Finally, I thank you once again for this symposium, and I pledge my ministry's commitment, of course that is the minister, not Katushabe, to improving road safety in Uganda. I want to thank you for God and my country.
And you send our regards to the Honorable Minister, and thanks for that commitment. And now we want to get into the analysis and proposed recommendations for road safety. To take us through is Esther Busiku Sharon, who is a policy analyst.
Thank you so much, Canary. I'm going to heed the Commissioner's advice when it comes to welcoming the protocol. So I would like to thank everybody for honoring the invitation for Center for Policy Analysis this Friday, the 17th of November. I'd like to recognize a few, actually all of us. I'll start with, of course, the lead agency, the mother body in charge of road safety in Uganda, the Ministry of Works and Transport. I would like to thank you for honoring our invitation, but also accepting to partner with us on this very noble cause on road safety. Commissioner, thank you so much. I would like to also thank the Office of the Prime Minister, in particular the Secretariat of the SDG Secretariat. Thank you so much for partnering with us. Mother organization, ROSACO, Honorable Chair, Chair, Mr. Tosime, thank you so much, and our partner organizations under ROSACO, thank you so much for honoring this invitation. I would like to also thank the Ministry of Health, who's also represented here. Thank you so much for coming. The KCCA, thank you so much. The Uganda Police Force, Directorate of Traffic and Road Safety, thank you so much. I would like to also thank UNRA. UNRA is in our presence. I would like to thank the Academia School of Public Health, Makerere. I would like to also thank, forgive me, the list is long, but I need to appreciate everybody. Representatives from the UIA, Insurance Authority. I would like to also thank the private sector, that is our truck drivers, our bus drivers, our border associations. Thank you so much for honoring this invitation. And I would be unfair if I did not appreciate the Center for Policy Analysis. My team has been really on ground making sure that we see today. My SEPA, maybe if you could just wave. The SEPA team, they are there in the corner. Thank you so much for putting this together. And also, in particular, I would also like to thank one gentleman. This is actually his baby. I'm so sorry. Godfrey Messenger. And thank you so much for the idea, the Road Safety National Symposium. He was part of the Center for Policy Analysis, but he's still a big part of SEPA and also a huge part of the Road Safety Advocacy Coalition. So just to kick off my presentation this morning, I've been hearing, I thought it would also be unfair if I did not speak on behalf of the Rosako when we talk about the nomenclature around road safety, when you talk about when you say accidents. A number of us have been using the word accidents, but actually as Rosako we are trying to see that we change the nomenclature to crashes, because when we say accidents, the assumption is that the individuals on the roads, the road users, most of them had no control over what transpires on our roads when it comes to a crash. So we are pushing that we see that the number changes to crashes and not accidents. So moving forward, I pray that we start using change the language to crashes. So road safety remains a huge challenge, and as already shared by the previous speakers, we are still seeing, even with the little progress that has been made so far in the sector, we are still seeing the number of crashes rising. We are seeing more fatalities happening, and I want to thank the previous speakers that at least shared the statistics when it comes to crashes. We are seeing that for the previous report, the 2022 report, we saw that the numbers were 20,000 plus. And yet, as a country, Uganda is looking to see that we halve these numbers, because we are committed to a number of, for example, the SDGs, SDG 3 want to ensure that the safety and well-being of Ugandans on our roads is adhered to, and see that these crashes are halved. But then also, according to the global plan, which was, I think, launched in 2022, the plan is to see that we see these numbers come to at least 50, will be reduced by 50%. But according to the report, the fatal crashes are still on the rise. We are seeing them at, for example, the fatal crashes at 16.9%, an increase from the percentages from 2021. The overall crashes at 17%. Then on average, as reported, we're seeing that we lose 10 people on our roads. And these are statistics that are actually brought to light, but we are seeing that these are actually, there are bigger numbers of people we are losing on our roads. And because we lose people in hard to reach areas, we lose people the victims in hospitals are never, some of them, of course, are never registered. There are those that, of course, the crashes that happen on the roads are never recorded, and yet the statistics are showing that it's just 10%, but this could be more. And I remember a report by I think the World Health Organization that I think put Uganda at position number 5 when it comes to the number of people we are losing on the roads. So this has to change, because over the last 5 years, we are seeing that these numbers are still on a rise. I want to thank the Ministry of Works and the key stakeholders that actually led to the development of the National Road Safety Action Plan, a plan that we as road safety actors are using to see that it guides us in reducing this number of crashes on the roads. This was launched in 2022. And of course, I also want to thank all the partners, stakeholders that assisted in the development of this, the National Road Safety Action Plan, the Parliament of Uganda. Thank you so much. Ministry of Health, the Uganda Police, UNRA, KCCA, the CSOs under Rosako, the guy, all of these work together to see that we come up with a plan that is going to guide us in reducing the numbers at least by 25% come 2025. So so far, and the guiding document for the reducing the crash prevalence was, of course, we were looking at, yes, the action plan, but also aligning it with the global action plan, which speaks to the 5 pillars of road safety. For us to realize an improvement in our road safety situation as a country, we need to focus on the 5 road safety pillars, and these are the road safety management that calls for a multi-sectoral approach when it comes to management of road safety. This is now all the stakeholders, of course, with the leadership of Ministry of Works coming together to see that road safety is improved. Then also the issues to do with safer roads and mobility. That's the second pillar. How are our roads being designed to see that they are safe for road users, and also incorporating the different road users who have been identified as the most vulnerable. These are the pedestrians, the persons with disabilities. Then also we have issues to do with the pillar on safer vehicles. How worthy are our vehicles to use our roads? The road to be on our roads? Are they safe and for Ugandans? Then it also, the fourth is to do with road safety users. Are they knowledgeable about road safety? How are their behaviors on our roads? How is their behavior on the roads? And this is now something that our Center for Policy Analysis has been really focused on, seeing to it that we strengthen the road safety policy framework to ensure that in its implementation, to ensure that we address the key behavior risk factors, that is drink driving, speeding, the safety belts, that is the child restraints and the seat belts, and also helmet use. And again, I would like to take this opportunity to thank the Ministry of Works and the key stakeholders that have been working tirelessly to see that the regulations addressing these key behavior risk factors are actually reviewed and gazetted and implemented. Although, of course, I know Ms. Sachi, of course, will be breaking down more about the regulations, but I just want to make it, put it out there that at least 4 of these regulations are so far out and have been gazetted as Center for Policy Analysis. We've even had them launched, and we've met with a few stakeholders to say that they are sensitized about them. They have a comprehensive understanding of these road safety regulations addressing the key behavior risk factors. Speed is, of course, will be soon out. It's under, I think, in the final stages of the review process. So, and then we have, of course, the fifth, which is on post-crash emergency care, and this, of course, is to do with how we handle crash victims. How are they handled on site, and how are they handled post crash, that is in the hospitals. And of course, I want to thank the Ministry of Works for that they'll be here, and of course they'll be sharing a lot to do with the post-crash care. But of course, as road safety activists and those under ROSACO, our work is mainly to see to it that at least the victims on site at least are handled, and we have to see that the first line respondents are able to handle such victims, so that we reduce the number of those severely injured and those that end up dying from the crashes. So a number of challenges have been noted when it comes to these pillars, and for us, and I thank everyone that is here today, and the conversation that we're going to have to see that we set targets that will, of course, inform the national road, supplement already existing actions under the Road Safety Action Plan to see that we even strengthen this plan and reduce the number of crashes happening and the number of fatalities happening on our roads. Because again, this of course was supposed to be a plan that runs up to 2026, but based on the statistics, the numbers are going higher instead of going down. So when it comes to road safety management, it's been observed that we have, as as key stakeholders, our appreciation of road safety is still on the low. We are still seeing it being less prioritized when compared to other matters in the country, and it, of course, we want to see that change. We want to see that we prioritize road safety when it comes to advocating for it, when it comes to financing it, when it comes to sensitizing the public more about it, because we are working for road users, so we need to see that they are aware of road safety protocols on our roads. Then issues to do with, I've already mentioned issues to do with resourcing. First, of course, I want to thank the Parliament of Uganda and the Government of Uganda for seeing to it that road safety, there was at least an increase in the financing for road safety in this financial year. Previously, it was at 600 million, but then it was increased to 5 billion. Now, when it comes to, of course, allocation of now the financing to road safety, that's another conversation, of course, that we are going to have later, because we want to see that even though we are appropriating funds for road safety, we want to see that these funds are actually released and doing what they're supposed to do. Then issues to do with national crash data management. That is a huge challenge for Uganda. And of course, as the representative from OPM already said, it's something that we are still grappling with. We need to see that our data management is boosted. We want to see that we do not have to only rely on the police crime report, because they are doing what they can as police, but then there are other partners that can actually provide more data, because these figures are not the actual, they are of course representative of what is happening, but not really representative of what is actually happening on our roads. And again, thank you, police. I'm sorry that I'm saying that it's not fully representative of what is actually happening, but at least we have some statistics coming from you, which we want to commend you for. Then issues to do with cooperation between government departments, that we noted is still low, and I want to thank God that at least we have the Ministry of Health here, we have the Ministry of Works, which is the mother body, at least to push to see that the departments come together. I was informed by my former lead on our road safety project at SEPA that the Ministry of Works now combine the departments coming from I think Ministry Directorate of Works and Engineering, and then also the Department of Traffic and Road Safety came together when we were working on the regulations. So we want to see that more departments come together to at least find solutions for road safety moving forward. And then when it came to safer roads and mobility, while of course we have seen an improvement in our road infrastructure, a lot still needs to be done, especially when it comes to planning for our roads while being mindful of the different road users and not just the vehicles and stuff. We still have the road network when it comes to NMTs, the non-motorized transport planning for pedestrians and cyclists, still on the low, and we want to see that at least the network is improved. Then issues to do with speed limits tailored for the road environment. We still are seeing that the signages on our roads are not as adequate. Some are being vandalized and things like that. So I want to see that at least we have more signages on our roads to at least guide road users moving forward. Then when it comes to vehicles, how safe are we in our vehicles, the worthiness of our vehicles on the roads. The vehicle standards are still need to be set. They're still in law. We do not have periodic inspection of the roads, the vehicles that are on our roads, to see that they are actually safe for road users, or actually worthy to be on our roads. And that, of course, comes to deals with issues of inspection, and of course ensuring that there's a strict and mandatory vehicle inspection of vehicles. Then when it comes to road users, being safer road users, we still see that a number of road users are not aware of, either are not aware or oblivious of the indiscipline or on our roads. We still have, and I want to thank the leaders of the associations, of the different driver and rider associations being here, because there are champions right now in ensuring that there's discipline on our roads, sensitizing the other road users about the different risk behaviors on our roads. We're still seeing people not mindful of things to do, things like drink driving. Someone is intoxicated but still insisting on being on the roads. We are seeing people, issues to do with corruption on our roads, people bribing enforcement, police, and somebody actually also taking bribes. Then things to do with distracted driving. We are seeing cars that are fully loaded on our roads, overloaded on our roads, and that is okay because, and they are moving like it's okay, and yet it's actually a crime to have an overloaded vehicle on our roads. Then the last one with post-crash care. Not long ago, I think that must have been in July, we had a member organization, LRSI, that organized the road safety run, and one of the key objectives of their run was to raise funds to sensitize first-line responders. It has been noted that while, of course, one of the two categories of people that actually rush, that are first when a crash happens, are normally, one, the community around where the crash has happened, and then the police coming in later. But then the emergency medical personnel come in a bit much later. So LRSI organized this run to ensure that the first line respondents are at least trained with on how to handle on first aid training for crash victims, so that they can reduce the number of fatalities on our roads. So that by the time someone goes to hospital, at least he is in he's not in a terrible state. And then we also, it was noted that, I don't know how many of us know the emergency call line. I don't, but I think there are preparations to have it in place and have at least personnel handling that system, so that we can have an emergency call system as Uganda. Then limited funding. We also held a meeting with the Ministry of Health not long ago at Parliament, and it was reported that they are heavily underfunded, and yet, and this is one of the reasons as to why there are challenges when it comes to handling crash victims. I think they requested for, I think, 400 million. Of course, Madame Maria will throw more light on that, but the ministry requires more funding, and to hear that some of the funds are yet to be dispatched is saddening, because these are funds that would obviously help to handle such cases. Then when it came to the number of ambulances available vis-a-vis our country, we noted that they are they are few. I'm not sure of the number, but at least Maria will let us know about the number of ambulances that are available for handling emergency care, and then the type of ambulances that are so far available, because there are types of these. I think the A, B, and C type of ambulances. Then issues to do with the management, the overall management system. It's still weak, but of course, Madam Maria will enlighten us more on how best we can improve the management system for post-crash care. So a number of threats to road safety still, of course, exist, and of course, based on my submission on following the five pillars, they are summed up to issues to do with funding, issues to do with competing priorities. Road safety is now competing with issues to do with construction of roads and other things. Then issues to do with corruption, which is still on the rise, and low stakeholder engagement. And that is why we are all here to see that at least we improve the stakeholder engagement, to see that all of us are doing our part as road safety actors. Then the opportunities that of course exist for road safety improvement in Uganda. Of course, based on the threats, we want to see that there's active participation of the different CSOs, because under this action plan, our responsibility is to ensure that the public is sensitized and awareness is spread across all the country when it comes to road safety. And we are not just spreading awareness, but we are using evidence and data collected from the different road safety actors. Then issues to do with an active informed media is also an opportunity for us to improve our road safety system, because we believe the media is our link to the rest of the citizens. We cannot reach everybody. We would have, of course, loved to see all of everybody here today, but we had to call a few of the actors to at least hear the conversation today and spread it out there. But we made sure that we invited the media to be present so that they can disseminate this information further. And then the availability of information on road safety. I've attended quite a number of meetings on road safety, and the information is information from the outside world. And yet, for us to improve, we need to get information that is, I should say, what would the word be? Is information that at least works for Uganda, more realistic for Uganda as a country, and actually is gotten from Uganda here to improve our road safety. And then issues to do with planning to increase road safety, the NMT implementation. We already have an NMT policy in place. I think it's a 2012 policy that was put in place to ensure that when it comes to planning for roads, we are planning with the vulnerable, the cyclists, the pedestrians in mind. So these are some of the opportunities we identified as the civil society organizations, and we want to see that we hear from government that is represented here what the status of some of these pillars, the road safety in relation to some of these pillars, and see how we can improve our road safety situation in Uganda. I thank you. For God and my country.
To supplement that, Esther just talked about is Cuthbert Isingoma from Uganda Road Accident Reduction Network Organization in Uganda. He's in the room. All right, is Samuel Mwesgwa around? He wanted to give us a poem on our topic today. All right, so let's take a coffee break. When we return, we'll go into the panel discussion on policy, financing, implementation, and enforcement of road safety interventions. We'll look at the challenges, the gaps, and the opportunities. But before that, Samuel Mwesigwa is going to give us a poem. And then after that, we'll take our break for about 15 minutes. We'll turn here with the panel. And then accidents. A day cannot pass without registering an accident on road. Drivers, stop killing innocent people. Why don't you give courtesy? You have made children to be orphans, women to be widows. Why all that? You overload us in your vehicles. You overtake in corners. You drive under alcohol influence. Drivers, are you trained to kill people? You are making roads manslaughtering areas. Drivers, why don't you value our lives? If all people that die in road crashes were to resurrect and give testimonies, then the live ones would never board your vehicles. Please, countrymen, let's join hands and reduce road crashes. Because tomorrow, it may be me, you, or your relative dying in these hands of killers. Thank you so much. The author of this poem is O.C. Afande SP Katurebe, who is O.C. now in Uganda. Thank you so much. Mr. Sachi, you're welcome.
Thank you, Director of Ceremonies. Good morning, our stakeholders in road safety, from the public arm, private sector, and the civil society. Today, I'm going to acknowledge the presentations that have been made before on the situation analysis on the transport sector and the road safety situation. And it's the reality that the road safety situation requires urgent attention and intervention to reduce deaths and injuries and improve the socio-economic situation of Uganda. So this presentation is going to focus on the policy and regulatory framework that guides road safety interventions in Uganda, as well as the stakeholder engagement in the pre-development, the development and implementation stage of policies, laws, and regulations. So Uganda has developed a strong policy and regulatory framework to address road safety in the country at all levels. And this policy is informed by the aspirations of Ugandans, the need to improve the competitiveness of Uganda, as well as international and bilateral obligations that we have as a country. On the policy levels, the transport sector, and specifically the road safety, is guided by a number of policies, plans and strategies. Quickly, we have the Uganda Vision 2040, which identifies the desire of world-class infrastructure and services as a key aspiration for Ugandans, and also highlights the need to develop a critical mass of transport infrastructure to lower the cost of doing business and to spur economic growth. The National Development Plan, the third National Development Plan of 2020-21 to 2024-25 lays out the Integrated Transport Infrastructure and Services Program, which is really the basis of what most of the infrastructure development and maintenance is done in Uganda, which aims to provide a seamless, safe, inclusive, and sustainable multimodal transport system to link production to markets. It seeks to strengthen and harmonize policy, legal, regulatory, and institutional framework for infrastructure and services. The National Transport and Logistics Policy was passed in 2021. That's recent. I believe a number of you participated in this well-consulted policy, and it identified the inadequacies, inequalities, and the inconsistencies in transport infrastructure and services, and provides guidance on investment in the sector. So it provides strategic interventions to ensure that appropriate safety standards are established for road safety, including improving interministerial coordination and developing a road safety strategy, among others. The Road Safety Policy 2014, it's a policy that has served a long time, but it had key elements. It identified the key stakeholders in road safety, including government, MDAs, Ministry of Works, Parliament, Judiciary, Ministry of Health, Ministry of Education and Sports, Ministry of Finance, Ministry of Justice, Ministry of Local Government, Uganda Police Force, UNRWA, local governments including KCCA, transporters, civil society, academia, media, medical practitioners, private sector, and the general public. It provided for policy response on road safety pillars of the decade of action, including road safety management, safer roads and mobility, safer vehicles, safe road users, and post-crash care. We are currently looking to review this policy to bring it on speed with current trends and the other emerging issues that have since come up. So recently, and this has already been talked about, we launched the National Road Safety Action Plan of 2021-22 to 2025-26. The plan sets out a target of 25% reduction on injuries and deaths from road traffic crashes by 2026. It seeks to strengthen the coordination and management of road safety programs, to plan, develop, and maintain a safe road infrastructure services, activate post-crash response, and to improve road safety generally. It's a 5-year plan costed at 600 billion, as you've already heard, and it has key thematic areas of action. These include road safety management, safe road infrastructure, vehicle safety, safe road use, and post-crash response. And the majority of you have participated and continue to participate in the implementation of this plan. It highlights the institutional framework, which is very key to remove any overlaps, but also allow for good coordination. The overall coordination is by Ministry of Works and Transport, but there are also other implementing stakeholders, and it provides the roles for all the stakeholders, including all MDAs, our development partners, civil society, private sector, the media, academia, among others. And it also provides a communication mechanism so that we can improve communication between the stakeholders, enhance public participation, and obtain feedback from the public. So there are other related national policies and plans, including the National Transport Master Plan 2008 to 2023, This is about to end. Then the National Integrated Transport Master Plan 2021 to 2040, which was recently approved. Non-motorized transport policy 2012, which recognizes walking and cycling as transport modes and provides for safe infrastructure for the pedestrians and cyclists. We have the National Medical Emergency Care Policy 2021, which streamlines the national response to emergencies at pre-hospital and hospital level, and by extension also deals with the post-crash emergency care. The Ministry of Works and Transport Strategic Plan 2020-21 to 2024-25, Ministry of Health Strategic Plan, same years, then the annual ministerial policy statement. So these provide the broad guidelines and policies upon which interventions can be made in road safety. We are also guided by the regional and international legal framework, the body of framework of conventions, agreements, and charters, including the East African Community Vision 2050, African Union Agenda 2063, the African Road Safety Charter. The charter provides a policy framework for road safety improvement in Africa, and it's an advocacy tool, an instrument for road safety improvement on the continent. We also have the Sustainable Development Goals. They were mentioned specifically. Goal 11.2 requires states to provide access to safe, affordable, accessible, and sustainable transport systems for all to improve road safety, notably by expanding public transport with special attention to the needs of those in vulnerable situations, women, children, persons with disabilities, and older persons. And we have followed this even in coming up with acts and regulations that we have come up with of late. We have the Global Plan of Action for Road Safety 2021 to 2030, which brought on board the safe systems approach in tackling road carnage. And that approach acknowledges that people make mistakes in traffic, and it requires managing the interaction between operating speeds, vehicles, road infrastructure, and road user behavior in a holistic way. Basically, not to pick out one thing and work on it in isolation as against the others. We have the Convention on Road Traffic 1968 and the Convention on Road Signs and Signals 1968, which harmonized international road traffic and also use of road signs and signals. Other conventions, we have agreement concerning international carriage of dangerous goods by road, the agreement concerning the adoption of uniform conditions for periodic technical inspections of road vehicles, 1997. And all these have informed the regulatory framework that I'm going to take you through. Okay. So regarding regulatory framework, government has put in place a robust legal and regulatory framework to address the road safety situation. And what I want to say is now that the laws are in place, we have to go to the next level. So the framework includes the Constitution of the Republic of Uganda as the grand norm, the Traffic and Road Safety Act 1998 with all its amendments, and specifically the amendment of 2020, the Roads Act 2019 and its regulations. It addresses broader aspects of planning, design, and development and maintenance of road infrastructure. Then we have the Uganda National Roads Authority Act, Kampala Capital City Act, Local Governments Act. Also, we have the standards, guidelines, rules, and codes that guide the transport sector generally. So, the Traffic and Road Safety Amendment Act of 2020. I'm sure many of you participated in consulting on this act, and that whatever was passed was actually coming out of the views and concerns of people to improve road safety generally. So this act was passed in 2020 by Parliament, and it updated the law and provided for emerging issues. There were many emerging issues from 1998 when the previous act was enacted. So it streamlined the management and administration of motor vehicle registration because it brought on board elements that would follow a car from the point that it comes into the country all the way to when it actually exits from the road. Then it provided for organization of public transport, which was aimed at ensuring self-regulation, but also ensuring that we have efficient transport services. It improves self-regulation, traffic management, and strengthens the enforcement of traffic rules in order to improve compliance and road safety generally. So the Act also enhances the penalties for traffic offenses and also introduced the demerit point system, where points are deducted from the driving license if a scheduled offense has been committed. This is aimed in complementing the existing enforcement measures, the EPS, to create a safety culture. Maybe the main reason why we brought on board the demerit point system is because people had gotten used to the EPS so much that they would put aside some money to commit the offense and pay the EPS too. They were really not paying the EPS. And in commercial vehicles, actually, the driver would even disappear and leave the burden with a vehicle owner who wasn't the actual person that the law targeted. So the demerit point system now targeted the actual road user by removing points from the driving license, and with that, you could either comply or we will find a way of getting you off the road for a stated period. Following the passing of the Act, as well as the other acts that, the other amendments that were made, the ministry reviewed and developed a total of 11 regulations to operationalize the Act. And there was a lot of stakeholder engagement in the development of these regulations, and it took some time, the better part of a year or two, to come up with the final copies of these regulations. So the regulations included registration place regulations 2022, demerit point system regulations 2023, digital network regulations 2023. These target the digital players like Uber, SafeBorder, Bolt, and the like. Then post-crash emergency care regulations 2023. The post-crash emergency care deal with, they require every medical facility to provide the first aid, the first response, the treatment of an accident victim once they come to their facility without looking at the person's ability to pay until the person is stabilized. Of course, the debt would remain with the patient, but after the person has been stabilized. Okay, so we wanted to eliminate the habit of people chasing away a patient on arrival, thinking that who is going to pay this. Then we had prohibited drugs and alcohol limit regulations. This was reviewed to bring it on board, remove ambiguities, and add a few offenses into the regulation. Then wearing of safety belts amendment regulations 2023. We realized that whereas especially motorcyclists were wearing the safety helmets, they were actually not fastening them. And what would happen is when a person had an accident, the safety helmet would fly off, and by the time he hits the ground, he has no protection on the head. So this specific regulation, among others, requires that you must fasten. So even if you have a helmet on your head, if it is not fastened, that's an offense. And we also look at the quality of the helmets by requiring that all helmets must comply with UNBS standards. Okay. Then the Traffic and Road Safety Motorcycles and Motorized Tricycles Amendment Regulations 2023. Then you have the Traffic and Road Safety, wearing of safety belts brings on board the child restraints. We had a big problem with children. Firstly, you find that children are allowed to sit at the front of the vehicle, and if you have an accident, that child is at risk of actually hitting their head against the dashboard. So the law requires that a child below the apparent age of 12 sits at the back, okay? And then a child below the apparent age of 5 sits at the back, but also uses child restraints. The child restraints are really what you would have as baby safety belts, or the carriers, those small carriers. It's to protect the children who are very high risk and very vulnerable. They will not control themselves in a vehicle. That's why we require them to sit at the back. But also they cannot use the conventional seat belts. Those seat belts are too big to actually protect them from any crash. Okay. We have the Traffic and Road Safety Licensing of Manufacturers and Garages Regulations, which target regulation of the activities of garages, as well as the manufacturing of motor vehicles and parts. Then driving tests and special provisions for drivers of public service vehicles and goods vehicles amendment. We have driving schools and driving instructors amendment regulations, and the appeal regulations. So in many of these regulations, even those that are not specifically on the 5 risk factors, we are actually focusing on the risk factors. As you know, we talked about the human element contributing 80%, over 80% of road crashes. So we have targeted those risk factors in whatever regulation you look at. Things to do with speed, alcohol use, helmets, seat belts, child restraints, okay? And for example, when you look at the demerit point system, we are looking to actually add sanctions on the driver behavior. So for example, if you're caught speeding, well, we can go to reduce your points and suspend your permit with the element that we shall change the driver behavior. And that would also target the risk factor of speed. And that happens for all the other risk factors. So the ministry is also finalizing consultations to review the traffic and road safety speed regulations. We intend to have a workshop, a validation workshop. We have done all the consultations with specific groupings, including the road authorities. We have had all the MDAs consulted. We have had civil society. We have had some transporters. We need to complete with a general workshop of all the parties in one room. And we look at these regulations and get a way forward. But specifically, there are key things in those speed regulations where we are targeting to reduce the impunity. For example, at the moment, we know that the currency points for speed regulations is 10 currency points, which is 200,000. If you are driving at 2 kilometers per hour over the prescribed speed limit, for example, in an area of 50 kph, you're driving at 52 kph. Well, you've committed the offense and you get your 10 currency points, EPS. But then even if you are driving at 150 kilometers per hour, in an area of 50 kilometers per hour, you would still get the 10 currency points, which we felt does not address the key problems that we have on the road. I think a deeper analysis of the accidents that we get will show you that most fatalities happen in trading centers, where there's a lot of interaction between the traffic and the humans. And we want to phase off this impunity, as in you can't be driving at that speed. You can't be driving 80 kilometers per hour on a place that is for 50 kilometers per hour. So we intend to almost triple or quadruple. That will come from the validation workshop. But we want to enhance the penalty for a person that goes way beyond the prescribed speed limit. We also want to introduce a lower speed limit for special zones. For example, the school zones, market zones, hospitals, churches. We want to reduce it to 30 kilometers per hour. We also want to provide that for what you would have as community access roads. For example, all the suburbs that you think of, the last mile, those will be community access roads. They are windy, they are narrow, and they are prone to children playing on the streets. And at the moment, you have that having a 50 kilometers per hour prescribed limit. We want to reduce it to protect the vulnerable groups. So on stakeholder engagement, as I said, the National Road Safety Action Plan acknowledges that that road safety is a shared responsibility. And with that, all stakeholders have a role to play. And government of Uganda has been keen on stakeholder engagement in policy formulation, in the legislative process, and even implementation of government programs. We get it from Article 1 of the Constitution, which observes that the power and authority of government is ultimately derived from the people. So it is the people that should determine their policy. It's the people that should determine the laws that govern them. And currently, we have a regulatory impact assessment, which is a key requirement in policy development, and you must do it. And it is the views from such stakeholder engagement that determine the action of government. And in coming up with the policy and legal framework that I've highlighted earlier, Ministry conducted very wide consultative stakeholder meetings at every stage to ensure that the policies and regulations reflect the aspirations of the people. We continue to engage stakeholders even after the development of these policies and laws through training enforcement agencies, dissemination and sensitization of laws to transporters, to the media, and even the general public. This is one of the engagements where people can bring in their views, and indeed I believe that we shall get views from this engagement. So government obtains views that can also guide the review of laws and policies. For instance, the change of law on lapse permits, which we did in the 2020 amendment of the Traffic and Road Safety Act, followed feedback from transporters, which was given in fora like this one. We believe that stakeholder engagement is a best practice and that it is key at all stages of policy development. At the pre-development stage, during development of policies and laws, and in implementation of the policies and laws. It is also a monitoring and evaluation tool to get the impact of the intervention, okay? Because at that point you're dealing with the users. So in conclusion, the major takeaway points for this presentation, Government of Uganda has developed a robust policy and legal framework based on aspirations of Ugandans and mindful of the national, regional, and international obligations to address the road safety situation in Uganda. As I said, that now it is time to act on these policies and laws to start implementation. The policy and legal framework has been developed through the active participation of all stakeholders in road safety, including government, civil society, private sector, development partners, and the road users themselves. We shall continue to engage stakeholders in line with the National Road Safety Action Plan 2021-22 to 2025-26, and we shall continue to review the laws and policies with the overall aim of creating a safety culture and achieving the objectives of the plan. I wish to thank all of the stakeholders on behalf of the ministry that have been pertinent in the development of the policies and laws. And I also want to urge all of you to support the implementation of these policies and laws. With that, I thank you all.
Allow me to invite the panel now that will be discussing, having a conversation on policy, financing, implementation and enforcement of road safety interventions, look at the challenges, gaps and opportunities. Allow me to invite SP Michael Kananura, who is the spokesperson, Directorate of Traffic and Road Safety, the Uganda Police Force. Founder, you're welcome. Irene Namiga from KCCA. Of course, Sache will also be joining us. Maria Nkalubo, who is going to be representing the commissioner. And Roland Nasasra, who is a journalist. He has dedicated his time to write features in the Daily Monitor about road safety. Roland, you're welcome. Okay, let me begin with you, Robert. I'll not let you settle. Maybe you could begin by telling us why these regulations, especially about speed, are not yet out.
Thank you. So, as I said, there's a lot of stakeholder engagement that goes into coming up with a regulation. And there were certain things that needed to be done by Parliament in the Act, because at one point the provisions on speed had been put into the Roads Act. And after a lengthy engagement between the departments of transport regulation and also the Directorate of Engineering, we thought that there was need to actually have that provision returned to the Traffic and Road Safety Act, and we requested Parliament, which had it returned. Following that, we have engaged several, because the review had so many components, including international obligations, and we are finalizing. We should have a stakeholder validation workshop soon. Thank you.
Thank you, Robert. And allow me begin this discussion with SP Kananura. I want to ask you this question. Looks like some of the statistics you, for example, put in the crime report do not represent the actual situation on ground. But the Ministry of Health and other government agencies say you do not share some of these figures with them, the statistics and the data, when you collect it. So why is it that some of this data reflected in your report does not represent the whole picture that is on the ground when it comes to road safety? Are there challenges?
Thank you so much. First and foremost, I would like to say that we may not, I don't think that we take every statistic or whatever accident that takes place, we register it. And of course, whatever we present is what we record from our OC traffic and or regional traffic officers. So you will find out that some accidents that occur, I think the victims are directly taken to the hospitals. So I think we'll find out that the Ministry of Health could be having much more statistics than what the traffic normally indicates, because I think there are some accidents that we miss out. And of course we have to present what we have already recorded or registered. there are some accidents which are hit and run, and then of course they are not registered or recorded.
But you have cameras. You have cameras on the road, and you control these cameras.
Not everywhere, my brother. There are some areas in deep villages where there are no cameras. These accidents don't only occur on highways. There are accidents that occur in deep villages where there is no technology, and of course we can't capture some of those things.
Do you have an idea on what indicators demonstrate, for example, the progress made in the legal framework for road safety, and how effective have these regulations, especially the ones that have been gazetted, been in addressing risk factors like drink driving, seatbelt use, or even helmet compliance? Do you have indicators to say, for example, there's been some progress, and here's how we know there's progress?
Yeah, the progress is there. We of course, as traffic being on the forefront of enforcement, some of these regulations are being implemented by us. So of course, along the way, we also find out some challenges. But so far, so good. They are really trying to help us. And as far as enforcement is concerned.
Okay. Irene, from where you sit at KCCA, in your own opinion, how has the amendment of the Road Safety Act in 2020 impacted road safety measures in Uganda? And do you, for example, are you able to point out some of the challenges that have emerged during the implementation of the amendment?
Thank you. And I'll start with saying that...
Maybe let's start with your title. I'm sorry I forgot to mention it. Let's start with your title.
Irene was enough. Irene was enough. I'm Irene Namika, and I'm a road safety engineer in KCCA. And the amendment has, in my opinion, let me say in my opinion, in particular has brought about the procurement for the formation of a road safety unit, because earlier on we didn't have a road safety unit. We simply had a department under another department. So in my opinion, we needed to improve the management of road safety in KCCA, and that for me has been the greatest achievement so far. And maybe the other thing that we've been able to accomplish under the amendment is we've looked at or had some work put in the reorganization of public transport for border sector and the taxi fraternity, and that work we've done with the Ministry of Works. Unfortunately, there's some incomparables, but we registered most of the operators of taxis, and we were able to assign them routes and route charts. We do have a few hiccups, but I think that we were able to achieve that, and we don't have so much work to do in that area. We've also had some border operators, I don't want to say registered, but the census, and all these are stemming from the amendment, because with the amendment there were several gaps that were lacking in our own systems as well, and we've been able to address with those, and most of it is actually public transport and obviously the motorcycle fraternity, who are our biggest victims in road traffic crashes. We've also looked at speed reduction, and with that amendment we've been advocating and participating in the formation of the urban roads manual, in which we were able to advocate for speed limits within urban areas or highly pedestrianized areas or school areas or areas next to schools. And if you look on our roads now, we've been more comfortable to put up the speed limit signs of 30 kilometers per hour, which we didn't have before, because earlier on we were all designing and planning for roads of 50 kilometers per hour, even in the city. So with that, with the urban roads manual, we've been able to do that. And I think off my hands or off my head, that's what I'm going to quickly come up with.
When you talk about the road signs have been able for speed limit,
Yeah.
looks like they only exist on the highways.
No, we've got some on in the city roads. A quick one I'll give you is Lugogo bypass, Ntinda, Chuatule. Everywhere next to a school, we've been able to place a 30 kilometer per hour road sign that earlier on wasn't there or we couldn't have done.
Gogo bypass, I'll pass there to Dan.
Yes,
and
even Ntinda next to
I don't know that
that,
it's me who is driving, concentrating on where I'm going, but I'm going to check.
Pass there.
Yeah.
Also, you can give me a call and I'll take you around.
Okay,
Yeah.
great. That will be a good start. Now, let me come to you, Maria. In what ways is government planning to engage citizens to influence behavioral change? Because in today's presentation, we saw that SEPA does recognize the importance of citizen behavior in reducing road crashes.
Thank you so much. To introduce myself again, I'm called Maria Ankarubo, and I work with the Ministry of Health as introduced by the moderator, as a Principal Operations Officer, and here representing the Commissioner. So back to the question, in terms of community mobilization for behavioral change, of course we know as a country that we are not doing well in terms of risky behavior in regard to road traffic crashes. But as a sector, basing on what we have streamlined under the policy, if you look at the National Emergency Medical Services Policy, one of the key pillars in there could be Pillar 8, brings out the issue of community sensitization and education when it comes to emergency medical services. So in this regard, we cover issues that relate to prevention, but also our strategic plan as a sector has shifted from curative to a preventive paradigm. So in all that we are doing as a sector, in our respective jurisdictions, we are mainly pointing to prevention. When we participated during the amendment of the road traffic, the Traffic and Road Safety Act, we insisted and pushed for the issue of testing. For example, the eyes of the drivers for visual acuity. Because we know 40 years plus, I'm 40 plus, and my vision, you can see, is laboring already. So definitely, for any driver on the road 40 plus, we asked Ministry of Works and Transport to make sure that there is annual testing of all those drivers within that category. We've worked closely with Ministry of Works and Transport to push for the to bring back the breathalyzers, because we had taken them off the road because of COVID-19. But as we speak of now, Ministry has assented to making sure that such interventions are back, because they are meant to address issues to do with risky behavior. But we've also worked with Ministry of Works and Transport under the same Act to push for regular medical checkups for all road users, especially drivers of all categories. In terms of chronic illnesses, we have issues to do with diabetes. So if you're diabetic, you're more at risk, especially when it comes to hypoglycemia. So you can easily get an issue on the road, or you're driving, you black out. So we are saying we can't all be healthy, but at least there are minimum standards for especially public transport drivers that they should be having, and that Ministry of Works and Transport has taken into account. Taking you back to the policy, the EMS, the National Emergency Medical Services Policy and Strategic Plan, we are pushing for community education and sensitization. We are trying to do it as a sector. But of course, resources do not allow. The demand is way too high compared to the available resource envelope. But nevertheless, we are working around the clock to see that we address this issue. So thank you.
Roland, let's face it. It looks like every government agency, institution is trying to do something. And indeed. But why then do we, in your own opinion, from your own experience writing about road safety, why do we keep having a repetition of the same year in, year out? In fact, the numbers are going high. Can't be losing 14 people on a daily. What exactly do you think, in your own opinion, is going wrong, especially in the interventions?
Thank you, Canary. And I personally am one of those people who believe that from a road safety perspective, as a country, we all need to be taken out, put somewhere as refugees. Then the roads and everything are renovated to the required standards. And when that is done, whoever does not meet those set standards does not come back here. The reason I'm saying that is we do a lot of talking compared to the actual work on ground. When I looked at the program, when I just walked in here, I could easily preempt what each speaker would say because I've interacted with almost everyone in the sector. So, for instance, you cannot talk of finding someone 2 million for speeding. That's practically impossible. Where are they going to get the money from in what people say is a hard economy? So I think we need to, and then when you talk of, for instance, when you talk of decongesting Kampala with, say, the bus rapid transport, and where you have buses that ferry people into the city, and then you have commuter taxis acting as feeders out of the city. A minister or an MP, you will find an MP or a minister owning, say, 50 borders or 10 taxis. And they are the same people who will say, no, they will fight the introduction of buses that can take on many more people and be less in number, because you are literally saying, no, you should be earning from your taxis or borders. So for me, I think it's we need that will and the commitment. When we, on the road safety group I'm on, with I think most members here, there is always a reference to Rwanda, which people unfortunately don't want to hear about. But they are doing far better. Rwanda, Tanzania, and Kenya, they are doing far better in terms of road safety. Unlike Uganda, where we will develop the best concepts, the best papers, the best laws and policies. But for as long as there is no will to implement, believe you me, we will become laughing stock. Thank you.
Interesting, right there. I know that, of course, we're supposed here on the panel to have the parliamentary forum on road safety. I didn't know there was a representative, but Honorable Didi, I'm going to give you time, of course, in our plenary session to be able to, of course, respond to some of the concerns. But let me ask Robert, how does the road safety strategy in Uganda align? Of course, this should have gone to the SDG Secretariat, but in your own opinion, do you think it does align, or how does it align with the SDG Goal 11, specifically targeting access to safe transport systems for vulnerable populations by 2030?
Thank you. You're asking about the policies that we have?
The road safety strategy that Uganda has.
Strategy.
How does it align with the SDG Goal 11?
The strategy looks at various components, and it's based on both the SDGs but also on the Global Road Safety Action Plan. Of course, the overall goal is to ensure that we use higher capacity vehicles, we use safer vehicles, and we deal with vulnerable groups, okay? but also it looks at the roles that each player can do, including what you would have as manufacturers, the transporters, to achieve what you would have in SDG 11.2. One, safe transport, affordable, sustainable, all that is packaged in different components within the thematic areas that have been identified in the National Road Safety Action Plan and the strategic plan of the ministry.
Okay, maybe this should go to Maria. What role do multi-stakeholder approaches play in the road safety sector, and how can collaboration be enhanced to achieve interventions that are sustainable?
Thank you so much. Definitely, road safety is ambiguous. You can't say it's purely a transport sector responsibility, and you can't say it's local government, you can't say it's Ministry of Health. So it's basically multi-sectoral and multi-stakeholder. So what that brings on board is lobbying and advocacy, because once we have one voice, including civil society, I'm seeing my brother nodding from Rosako, the chairperson. We've worked so closely on that. So once you're together as a team, definitely you're building capacity for lobbying and advocacy. Lobbying and advocacy in terms of, when you talk about lobbying and advocacy in Uganda, someone thinks about financing. It's beyond financing. It also covers issues to do with awareness creation, because once you're speaking as one voice, definitely you catch the attention of everyone else. And then number two, of course, finance will come into play at that point. If you're able to come together as a team, as MDAs, civil society and academia, definitely, and we speak one voice with enough evidence provided, government will absolutely allocate resources to road safety. We've seen it, moderator, when we went to Parliament. It is, and we're invited by SEPA, the same host for today, to make our presentation. So just that engagement was basically, for me, a platform for a multi-stakeholder approach to road safety. And from the report that we've received from SEPA today, has points to do with inadequate financing for the health sector when it comes to emergency medical services that is urgently needed by everyone. That's the only way you can lobby, coming together, multi-sectoral. But also information sharing. Moderator, when you come together now, like today, this is another platform where we can define a multi-sectoral, multi-stakeholder approach. We are sharing quite a lot. I know someone walked in here and didn't have a few notes of about what we talk about in road safety. And by the time you leave the room, you'll be a different person, because you'll be better informed and more confident to talk about this subject wherever you are. And the more we spread the word, the better for the people we serve. Thank you.
You talked about information sharing. Do you have challenges with, say, institutions like Uganda Police in information sharing the right statistics?
Actually, I heard you mention that at the start. Uganda Police has no problem with sharing information because most of their reports are published. The issue is about the methodology of data collection. So what they have collected in their capacity is what they share. That's what they have. Now, we as a sector, for example, you talked about cameras. There are cameras everywhere. Why are you missing on data? Ugandans are wise. They will beat the cameras to run away from police and quickly access health services, because automatically when you're injured, the first point or something you think about first is access to care. So you beat police and run away because you don't want to be implicated, you don't want to be asked, and naturally because maybe we are, I don't want to use a harsh word, so we most of the time think we are going to be taken on by police even when you're innocent. So the police has no issues with sharing data if it's public information. That's why everyone here talks about the 45,000 or whatever people that are dying annually. It's data from police, though we have different statistics as already indicated here as Minister of Health.
There you go. SP Kanara, I want to ask you, the enforcement. One, the worry arises about traffic enforcement in Kampala vis-a-vis traffic enforcement in new cities, where boarders, for example, do not care about wearing helmets and reflector jackets at all. There's too much abuse of traffic rules in the new cities. Looks like you have concentrated a lot on Kampala. But also here in Kampala, the traffic officers have turned enforcement into a business. So do you want to respond to those concerns?
Thank you, Kanare. I think before I answer, I wanted to understand how have they turned it into a business before I really comment. But then one of the other challenges, by the way, that we normally encounter, there's nothing difficult like carrying out operations on those borders. You have seen it sometimes when we are doing those operations. At times we even register some deaths where someone is coming and then is aware that the operations ahead. They are forced to make U-turns and then are knocked by oncoming vehicles, and also injuries that occur to the riders and to some innocent passengers. And of course, you know that when we mount out these operations, boda can pass anywhere. You see them running and taking shortcuts, entering in Bikubos and all that. So it is really it's like really going to a battlefield when we are carrying out those operations. However, in Kampala, of course, we are much concentrating in Kampala because we see a lot of borders in Kampala compared to the rest of the cities. Then we also, of course, tend to have some good manpower in terms of traffic officers. I think around out of 1,500 traffic officers we have in the country, Kampala has more than 60% of those traffic officers. So it becomes somehow easier for us to conduct these operations. And also, you also notice that it is easier for us when it is jammed that we conduct these operations effectively, and then we are able to have these violators of traffic regulations. Whereas the other places, you know what it means. There is nothing like it. So getting them really, it is a challenge, and of course also looking at the issues to do with the human resource or manpower and all of that. But of course, we have not left that out. We still conduct, and whenever it comes to every end of the week, we collect statistics from every part of the country. So every district carries out, only that you find out that Kampala has done better or has got many people compared to other districts or cities.
Yeah, so maybe to stay on that point, what I meant by traffic officers have turned the operations into a business is that instead of enforcing penalties, they actually take money from the border riders. Because you're in traffic and then you see border being taken away, and then when you observe there's money being exchanging hands. That's what doesn't that undermine traffic enforcement?
One, I don't deny the fact that there is corruption and bribery in such operations. However, like I told you that we normally get the statistics of what has happened. How many motorcycles have been impounded, and the number of motorcycles that have been issued with tickets, and those that have been taken to courts of law. And if there are also cases of corruption or bribery, then we also need to understand. But we don't get some of this information. In fact, I'm getting it from you that when they are conducting those operations, that they solicit some money. So we really need that evidence. Of course, they say that your alleges must prove. Every time we talk about corruption, it is a very sensitive issue. And like I started, we are not denying the fact. However, who starts it all? It's not the traffic officers, by the way. It is the people on these roads. The moment someone is stopped, all they think about is to pull out money. And I always told people, it's like you are exchanging money at the expense of your own life. Because this traffic officer is telling you, please, you are speeding. And kind of here you start now think about how heavy the receipt of speeding is. So you think you can exchange 5,000 with that. So it becomes somehow for us a challenge as maybe supervisors, because even those who are giving in money, they are into it. They are supporting it because that's why they think it works out for them. But of course, we have the team of, we have the officers of Alert Squad who are really handling that, getting information and acting immediately to arrest actually both the people who are giving in the money and the officers who are receiving this money. So this is something serious that we need to combine efforts when it comes to corruption in traffic. We can't do it alone. We can't fight it alone. After all, you are the people who are giving in this money. So before you give in this money, can you tell us, can you call us and give us information? We have often shared the toll-free numbers and our personal numbers. And when we also talk about corruption, Mr. Canada and the rest of you, it's not only to do with the exchange of money, but even when you arrest and then you think you have Kanana's number, you heard that Honorable will talk about Gambano. It's a very serious issue, by the way. And then you think you have my number, then immediately you call and say, I've been arrested here, and you know you don't have a permit, it is even expired. And then, of course, expect me to speak to my officer, and the officer will not refuse because I'm his supervisor or her supervisor. So such things really. And then you go free because you know someone. That is also corruption. Exactly.
Thank you for sharing. Irene, engineer, I want to understand, considering the increase in road crash prevalence in 2023, in your own opinion, what additional measures or strategies should be considered to reverse this trend?
I find that my opinion usually is very controversial, but it remains my opinion. And in my opinion, government is doing everything that they can in the situation that we are in the environment that we are in. And to my brother here, we are not going to remove people from Kampala to be able to solve the issues of Kampala, because the issues of Kampala can only be solved by the people in Kampala. It's until the people in Kampala change that any issues that we have can be solved. Even if you take them out, when you bring them back, it will be the same thing. So for me, I would say that our drivers on the roads, there's so much that has to change with the drivers. Much as we put up all these measures, you put up humps, you put up road signs, you have enforcement, you put up NMT corridors, all these things are really, there's a problem with the Ugandan drivers, to be honest, or with the Ugandan residents. The signs are stolen by Ugandans, the pavements are driven on by Ugandan drivers. The yellow boxes, everything that we've put up has been violated by the drivers. I know people will say that even pedestrians and cyclists have a lot to play, but that's not true. The reality is that our drivers, people who are on anything that is motorable or has a motor in it, have a lot to play in whatever is going to change. No matter how much you put up, the NMT is full of border borders. The section that is supposed to be for bicycles is full of border borders. The parking is full of cars. So in my opinion, measures, enforcement are all in place, but the drivers themselves are not meeting us halfway, and they must meet us halfway. And whereas we want to blame the government agencies for doing little, which I agree we may not have done 100%, but we are at the point where our drivers and our residents and the people that we are doing this work for are not meeting us halfway, and consequently we are walking backwards.
It probably because of your, it could be your own problem as government, in terms of there's not enough awareness and information out there in terms of the use of the road. You woke up one day, drew orange boxes on the road, not explain to the border borders what those things meant, and you expect them not to violate the rules? They definitely will, because they do not know, they do not understand what these things are for.
I have done awareness around those yellow boxes. I've done about 5 awareness projects and engagements. There are border people out there, and bus drivers and leaders that know my face. They're even smiling and looking away because they know that I've engaged them in different forums about this. And we may not be able to engage, for example, 20,000 border riders, but when you engage the leaders, you expect this information to trickle down. I've been on TV, I've been on radios, I was talking about these things, and I think Ugandans have a habit of turning a blind ear, but not blind, but blind eye, not eye, but ear, like a deaf ear. Even when you say something, they hear it, but they don't hear it. They don't internalize it. And obviously, the speakers before today mentioned the issue of assuming that it's not your problem because it hasn't happened to you. It's until it happens to you or to the person you know that it becomes a reality of your life that, yeah, this is a reality. And the spirit of individualism, unfortunately, in all drivers is what gets us here. So many things have been done. Yes, we may not be doing enough, and I'm not going to sit here and say that we've done what we can do. I'm not going to say that. I'm simply going to say, at the point when you know, you as the driver who knows, do you stop? Or do you also go because somebody is hooting or asking you to continue or to go forward? Are the drivers who know stopping? Are they giving way to pedestrians? Are they giving way to the motorcyclists that are true? They drive carelessly, it's true, but do we give them way? At the point when you know more than the person you're driving towards or who is driving, you're driving behind, do you do the right thing? And I find that oftentimes many drivers don't do the right thing, even those that know. Even those that are literate, even those that are aware or engaged, they are not doing the right thing. And the people who know and are in leadership positions like our border fraternity and taxi drivers and bus drivers, are they passing this information down, or is their leadership about survival? And I think these questions, much as, like I said, I'm very controversial, much as it's out there that government agencies are not doing enough, I equally put that on the table today. Are the people that we are engaging, or the people that know, are they doing what they're supposed to do? And if they are not, what is the problem? Is it that the driving schools are not good enough? Is it that we need refresher courses every time you're applying for permits? There is a problem that is with our drivers or the motorists, and that problem is not going to be addressed by giving them more roads and more measures. We cannot fill the whole of Kampala with humps. It's unrealistic. It's very, very unrealistic. At a certain point, driver behavior needs to come up and meet us halfway. Thank you.
Okay, Roland, looks like it's become like a blame game. Government, you're not doing enough. It's you, the drivers, are not doing enough. You're not meeting us halfway. But there's a major problem, of course, especially here in Kampala. And I wanted to use this example on the engineer, but let me use it since she's from government. If your boss
you can use it.
I'm careful not to offend you.
No,
but
you can use it.
Roland, okay, now that you've given me the permission, let me use it. If your boss pushes you off the road with her convoy, and you know she does not have the right of way, how will you then feel the urge to say, Mia, I'm going to respect the road rules? Because you've been pushed off the road, you're in the same traffic with your boss, as if that's not enough. While you approach the junction, a UPDF officer jumps off a pickup, starts to direct traffic on top of even finding a traffic officer on the road. You feel disgusted, and you know what, you be like, as a road user, I'm also going to do it my way. After all, there's no respect, there's no courtesy from all these drivers and all these people who have decided to get convoys and abuse all regulations and rules. So do you think that really that the drivers that you're blaming that are not meeting you halfway, that they're doing it out of maybe impunity, but the impunity is coming from the leaders who are supposed to be respecting the rules?
I agree.
Roland, let me put that. It is true. It is true.
It is very true.
What can be done about it?
It starts from the head.
I just told you the head is actually the one abusing the road.
Exactly. Maybe we need to engage the head.
Roland, what needs to be done? I don't know how many times SP Kanano has spoken, said, please, you need to respect the rules, but even the bosses...
Engage the head.
The bosses...
Engage the head. Yes.
Roland, it's become a blame game. It's you, the drivers, it's you, government institutions.
I think what can be done is really much, but from a personal perspective, there needs to be political will and commitment. Honorable earlier on said most people feel like it's wrong. I mean, those in high offices feel like it's wrong for them to be in a traffic jam. But it's only when you are in jam, as say a PS or a minister or an MP, that you get to actually feel what it means to be in traffic jam. The reason why we have a lot of impunity is, like Irene said, everyone feels entitled to a point that you have people like Baram Balgahari, a socialite, having a lead car. What for? What kind of nonsense is that? Baram, of all people, if the other day, I think it was last evening, I was from Nigeria, and I saw a police lead car with, I think it was someone from the Ministry of Gender. They were in jam, and they were patient with it up to the end, even when there were not much cars coming from the outgoing lane. So what needs to be done is let our leaders lead by example. If you say, look at the convoy of the Chief Justice with their lead car, when who has the right of way, behind them you will find like 5 or more vehicles.
Because they have red number plates.
Exactly. Not even red plates, even these ordinary plates. You find that they follow immediately, and before you know it, they are creating 2 or 3 illegal lanes in our narrow roads. They've even been made worse by potholes, which I think have become tourist attractions of sorts. But let our leaders act by example. You cannot have SFC patch up potholes in Kampala along a road where they know the president only uses. Why can't they go and patch up those potholes in Namongo side? When you take an example of Mokwano Road, when it rains heavily from morning or overnight, and you're going to send a steward for a meeting, it's like a field where sweet potatoes have been harvested that we literally have nowhere to pass. So let our leaders lead by example. If you don't want to be inconvenienced in traffic jam or by creating illegal lanes, plan your journey and start early. If your meeting is at 10 and you expect traffic jam, there's no harm in leaving your home at 7 or 7:30 or even earlier. I think that's it from me.
Certainly. I want to ask something about measures, but before that, the government has allowed everyone with a big car to have amber lights. I know musicians, just because they drive big cars, they have also put on amber lights. They drive on the roads like they own them. What can't you rein in on the indiscipline and impunity on the road? Because every time this question comes up, you throw it to the police because they are the enforcers. The police are saying we're actually overwhelmed because we do not have the capacity. We're doing our best.
Thank you, Canary. Well, we all know who should have a lead car, who should be an authorized vehicle. My minister has written several letters requiring enforcement, and in truth, police has actually enforced with some consequences, I should say, but police has enforced. Now, without going into the blame game, how do we get out of this? And I think the main thing is technology. The only reason people are acting with impunity, especially within Kampala here, is because they can impose their their superiority over a person. We are looking at a time when we have cameras, both ITMS and Huawei, where you're not going to talk to anyone, but an EPS is going to come to your accounting officer. If you're an accounting officer and you're receiving 1 million, 2 million, 3 million to be paid because of some driver that is driving in a certain way, it doesn't matter who he's driving. Are you going to continue paying that money because it's a bill against you? Will the Attorney General allow you to continue acting that way? Will the Finance Minister or the PSST allow you to continue spending money redundantly like that? Then as a driver, I may be driving the permanent secretary, I may be driving the AD. When this demerit point comes onto my permit and I'm losing points because of the way I'm behaving on the road, without being able to talk to this officer that is on the road, will I continue to do that so that 6 months down the road, my permit is suspended? I think that is the way to go. We have to remove the subjectivity and allow technology to take over. And I believe that when we fully implement these measures that we have in program, that some of these things will get out by themselves without having to burden the traffic officer, without having to burden anyone. The camera will capture the image. An APS will go to the accounting officer because the vehicle is known. And because they know who is driving the vehicle, the demerit point will come and attach to your permit. So I believe we shall solve that issue with the technology.
Interesting. Maria, let's talk about the vulnerable groups. What measures are in place to address their specific vulnerable populations include, of course, persons living with disabilities, women, children. So the interventions for road safety that will come up, how are we making sure that they address specific needs of these populations?
Thank you so much, Canary. Before I answer that, I'm not causing alarm, but I felt I needed to alert the House here that according to our report for the previous or last financial year, 2020-2023, we now have road traffic injuries as the 4th leading cause of death in Uganda. Initially, the previous reports had 8th. It was normally ranking around 8th, 7th. But as we speak of now, 2020-2023, road traffic injuries are the 4th leading cause of death. So this is something that is very important for the House to know as we go on with these deliberations. It just crossed my mind that I need to share this. There is much more in terms of the burden that I will be sharing later, but in regard to the vulnerable populations, as a sector, we are in line with the policies that have been put in place by government, and especially the lead sector, Ministry of Gender, Labour and Social Development, as regards vulnerable populations. Number one, when we are drawing policies, they must be gender sensitive, and gender, of course, covers vulnerable populations. So, for example, if you talk about equipping of an ambulance vehicle, you must be considerate, and in fact it is laid in our strategic plan, that an ambulance that is moving, for example, a person living with disabilities should have such and such equipment. And for the number of ambulances that we are procuring right now, we have taken into that as a consideration seriously. Then, of course, vulnerable populations may not just be people living with disabilities. You're talking about women. Now, let me talk about women and women who are living in hard-to-reach areas. So, in addition to the numbers of, for example, the ambulances that we are procuring, we are also considering those that are living in hard-to-reach areas like islands, and that's why you see recently we procured boat ambulances, because we know majority of the users of our infrastructure are women and children. because of the mortality rate. Yet, yes, I congratulate Uganda because we've had a significant reduction of maternal mortality and infant mortality, according to the previous UDGS report. But that doesn't stop us from continuing on pushing the agenda of vulnerabilities, and especially women and children and people living with disabilities. Canary, you know we have procured over 225 ambulance vehicles, and majority of the users, like I've indicated, are women and children. When you look at the statistics, and then I've also hinted on the boats. It's mainly women and children in hard to reach, and of course the infrastructure, the equipment that we use on our ambulances are specifically cater for the vulnerabilities, especially people living with disabilities, and plus the policies that are gender sensitive. That's what I can say about it. Of course, there's much more that needs to be done. There's still a gap, but we will be addressing that as we go on here.
Let's get to the hospitals. Maybe you could inform us in what ways can health systems be further equipped to handle emergencies resulting from road traffic crashes, and what role does government play in the readiness of these systems? For example, I understand if someone is in a hard-to-reach area, by the time they get to Mulago, the situation has gotten worse, and there are no experts in some of these areas.
Thank you so much, Canary. For us to appreciate what government is done and what the aspirations of government are, we need to first appreciate the burden. Previous reports, the most recent reports that we have, indicate that 400 to 600 patients report at accident and emergency units. That's the case of Mulago, for example. And of these, 80 to 85% are orthopedic patients. And of these, 400 of them, if there are 400 to 600 patients at the accident and emergency unit, for example, in Mulago, 400 of them end up in the ICU. Now, when you go to the ICU, 83% are male. The male in the house, you can take note of that. And 90% are neurosurgical trauma patients, those that result from especially RTIs, the road traffic injuries. Of those that end up in the ICU, 53 are discharged, but 47 do not make it because of the nature, the severity of the injuries they sustain. Now, in addition to that, as background information for you to appreciate the status quo, the cost that government incurs on treating neurosurgical patients is exorbitantly high. For example, for minor injuries, ministry or government will spend around between 1.3 to 1.5 million Uganda shillings. Minor bruises, small stitching. But where someone has sustained neurosurgical injuries, issues to do with the head and the spine, and they're ending up in the ICU, government will incur a tenfold of that. That means to come to roughly minimum 15 million, 10 to 15 million on a single patient. Now, looking at the numbers of the patients that report, and by the way, what I didn't share about you, this majority of those are border riders that report at accident and emergency units, and are the ones that mainly sustain the neurosurgical injuries. So that is the burden in brief that I can share with you. Now, back to preparedness and in terms of readiness of facilities. As government rallying on the NDP3 Vision 2040, now the parish development model, if you look at section 3, but also if just you go to the NDP3 section 3 it does indicate the commitment by government to establish resilient emergency medical services systems that are readily available for the population to attain. So in that regard, emergency care is a continuum. You can't just talk about a health facility. So we are approaching it in a way that we are considering, for example, care at the scene, because if you have people attended to at the scene, definitely it has an implication on the outcomes of the patient at the facility. The same applies to transportation, the means of transport they are using to get to the facility, and then care at the facility, at the accident and emergency unit. That's what covers emergency medical services. Now, isolating out care at the facility in terms of preparedness, of course, we are looking at human resources because, you know, as a sector or as a country, we are grappling, and not just a country, but a region. We are grappling with human resources for health. The numbers are low compared to the cases that are reported to these facilities. But zeroing down to emergency medical services, we need a minimum of 425 emergency care professionals, minimum. And these are in the category, I'm not including the call and dispatch officers, those that are going to be situated in the call and dispatch centers. These are just the cadres that we want to establish at health facilities. Now, of these, we have only trained roughly 30. It is a shame, but it is a move in the right direction because these have just been instituted. For example, we've established a residence program for emergency care physicians. It was non-existent in Uganda at Makerere College of Health Sciences, Mbarara University of Science and Technology, and then I think Nkozi University has also taken on that residence program for emergency physicians. We've so far graduated 17, 13 are locals, the 4 are internationals. So that is human resource. Now imagine graduating 13 emergency care physicians versus the 45 million people that we have in the country. So what we need is support, Canary and the rest of the House. When we come out, our chair, parliamentary committee on road safety, when we come out with budgets, that we want scholarships, because the 13 were funded by a World Bank scholarship at both Makerere College of Health Sciences and Mbarara University of Science and Technology. The population cannot afford at times some of these programs. So we need support from government and development partners. We are trying to write proposals to see that we get scholarships for emergency care physicians, for critical care nurses. We've also started a certificate program for emergency medical technicians, those that are supposed to be working on you while in the ambulance. Not everyone should be attending to you in an ambulance as you get to the facility that Canary is referring to. It's a specialty. Someone must be trained on how to manage a critically ill person that is moving in an ambulance. Not every nurse is a critical care nurse. You know, there are different specialties. So we are pushing for critical care nurses, but we've also tried to establish a training program, and it has already started in Rubaga Training School with support from a development partner to do certificate program for emergency medical technicians. It's a 2-year course. We are also working with another development partner to establish a diploma course. I think Minister of Education and Sports has already moved a step on that for emergency care providers. So that is in summary as regards the human resources for emergency care when it comes to facility care, transportation. Now, human resource for scene, because Canary, it doesn't help to have a well-structured emergency departments, and yet the community is in problems. You know, on major highways there are stationed thieves there waiting for a road traffic accident to occur so they can rush in. By the way, they are there permanent. Once a car overturns, they will run in fast to rob whatever these victims have. We have evidence for that. So as ministry, we are saying in our strategic plan that let us train and educate the community at household level. It is very, very expensive, 45 million Uganda shillings, and the budget of now, the last financial year, I think it was 3.6 trillion. And as a department, I think we are getting a 0 point something % from that. very bare minimum. So as we want to see that we create a critical mass of community first aid responders. We have started on the work through development partners, but we need government commitment in terms of resources such that every Ugandan is reached to be able to respond to emergencies. You can resuscitate Canary. If I collapsed here, leave alone road traffic injuries, you can save me. You can save my life. I don't need a medical doctor here because they're supposed to be in facilities. Likely doctor is here. Those are rare cases. So we believe community can be empowered to provide first aid on the roads, to provide first aid in the homes, and then transportation streamlined. You can hear I've told you we are buying these ambulances, and then structure the accident and emergency units in terms of human resources, in terms of essential commodities. That is the second item in regard to your question. Essential commodities. As a country, we are declaring, and this is a message from my commissioner, I had a brief with him before coming, that he does acknowledge the gaps that we are having when it comes to medicines and supplies, especially emergency medicines and supplies. We don't know whom to throw this question to, but engagements with the national medical stores to really improve in terms of access to medicines, essential medicines and supplies for the population. And of course, in terms of the facility, again, back to your question, we are looking at, apart from human resources, essential, the equipment. Equipment, of course, government has tried. Recently, we procured 12 CT scans that are deployed in different regional referral hospitals. Of course, these support quick diagnosis for trauma injuries or neuro-related injuries, and therefore enable quicker interventions to happen. But there is much more. 12 CT scans and the 45 population is a drop in an ocean. So what we are saying is, again, to our chairperson here from Parliament, funding. The issue is funding. My colleague here said we talk and do less, but we have our policies, like we indicated, in place. If they are not funded, or they are funded at bare minimum, it makes our work difficult, and it actually goes down, zeroes down to the population that is receiving our services. Lastly, in terms of health facilities, we are looking at information systems. When I come here and I start talking without evidence, that's why I had to share with you the burden with evidence. When you talk without evidence, you're actually presenting your personal opinion. You're presenting about something you saw somewhere, whether good or bad. So what we are doing now, we have incorporated indicators on road traffic injuries. They were there, but they were minimum. We have refined them and retuned them such that they can speak to what we want to hear as a country in terms of evidence, such that when we come back next time, we should have good data that is disaggregated. Initially, I think we had indicators on injuries due to, or deaths due to motor vehicles, motorcycles, bicycles. We are missing pedestrians, and I want to report to the community or the population present here, or the audience, that we've added pedestrians. It was a missing indicator. So we are trying to review and refine our indicators, and I want to report to the public that our information system has embraced emergency medical services. We have quite a number of indicators there. If you want data, please come to the ministry so you can get the evidence you need. Now, talking about data, going back to the police data issue, what we need is just a system that integrates police data and Ministry of Health data, so we come up with the rightful figures. Otherwise, the data is already being generated, is there. So I think that's what I can say. There's quite a lot. You know, if I begin talking about emergency care facility, transport, and scene care, cannery, the cows will return. They will get me here.
I can see you're talking passionately about it, but you just talked about data. Let me go to SP Kananura. Let's look at the opportunities now. What are the opportunities in enhancing the effectiveness of the processes in terms of how data is collected, managed, and reported?
Thank you once again. Of course, we also look at, we need to look at the emerging technology which is in place, which is being used. As I speak, recently we had officers training by Bloomberg in the same, so there are some softwares which are being used now to have that data collected from every officer. And then I think probably with time, then we shall see how best we can start sharing such information with our other partners or stakeholders for effectiveness. Yeah, basically that is it.
Okay. Before I go to the parliamentary forum on road safety, I want to quickly have a question go to engineer there. Let's look at the opportunities. How does government then plan to enforce regulations, especially those related to drink driving, seat belt use, and helmet compliance to ensure a significant impact on road safety? From where you sit as KCCA? I understand there's been engagements going on, especially around for the borders, but what about the other motorists, pedestrians? But I understand that some of these enforcements are around seatbelt use, of course, drink driving, and helmet compliance.
Helmets is easy because already that's underway with census of the border riders. And then when it comes to registration, you just make it mandatory and a prerequisite for them to be able to register as operators within the city and maybe elsewhere or in the neighboring cities. So helmets is easy. Drink driving, on the other hand, I think we have to be more innovative on how we do that. And we may not be able to do it just simply as KCCA, but maybe through other partners like bar owners or what are they called, lounge, the areas where people drink from. And if we are innovative enough, or if it's something that we can look into quickly, I think we can engage them with Uber drivers, safe borders, things like that, so that somebody knows they can afford to go out, have a good time, but they don't have to drive back. But I've seen it work in another city where as you enter a bar, you leave your key, and on your way out, they call you an Uber or a taxi.
So they assess you whether you're fit to drive?
No, they don't assess as you enter.
What I'm saying, as you get out, do they assess to give you back the key?
They don't give you the key. They just call you a taxi to take you home. And
that would be innovative, actually.
It is very innovative, I find. But if it would work here, is another thing, yeah? But like I said, you have these solutions we have to create based on our environment, coming from the people that are supplying the alcohol, but also the people that are willing to supply the service of transportation. I mean, you ideally want to get home. It's mobility at the end of the day. And you can pick up your car tomorrow. You don't have to go with your car when you're drunk. But who is seeing that you're drunk? Is it the person who is drinking or the person who is giving you the alcohol? But all those are innovative ways to look at. And obviously,
these days, SP Kananura's friends will even alert us before before the clouds go dark. Say today, because I've seen actually tweets from Uganda police say today we're going to enforce, and they intensify. So then you know. Do you think that, for example, innovativeness? I've been to cities where they do not serve exceeding a certain amount of alcohol, no matter how much money you have. But this is a particular context here in Uganda that perhaps some of these things cannot work. When you talk about, maybe like she said, we need to be able to increase funding for people to go out there, explore and understand, innovate ways, give them scholarships for them to think solutions towards road safety.
I agree with that, and I also think anything can work in Uganda. I am one of those maybe idealists, but anything can work. It just needs us to commit to making it work. Oftentimes, only one arm has committed to making something work. Much as KCCA will commit to making it work, if the other stakeholders and partners in this do not commit to making it work, it won't work. And on that note, I think on this panel we needed someone from URA, and some of the issues we are addressing and speaking about cars, old cars, or motorcycles, even someone from UNBS, yeah? And we're speaking about these lights. People are shipping in these lights. They're not made in Uganda. They're shipped in. If we so don't like them and we think that only ambulances must have them, why are they on the market? And if they should be on the market, should be a licensed person to supply for only ambulances, something of the sort, or maybe if they're for the army, it's the army, a shop for the army people to supply those. I find that there's a bit of laxity in things that can contribute or can enhance the road safety systems, and because those other arms may not necessarily be as engaged as we engage other stakeholders. So when it comes to seatbelts, again, the same thing comes here. We have old cars, old cars, from second owner to third owner to fourth owner to fifth owner, and when you're tired of your car, where do you sell it? Where do you sell it, and where does it go? And when it goes there, who is using it? It's still people that are using it. And no one is monitoring this kind of thing. So I think that there's still so much that we can do as different stakeholders and partners. I can comfortably say that where we are now, from where we started, we probably are maybe at 50%. But there's a fraternity that we still think has a contribution, and in all these engagements, in a panel like this, should be on the panel, because then you trigger someone's mind on what can they do differently, where can they start from. If you brought somebody in URA who is in charge of maybe vehicle importation, they would know better to now begin to implement policies or to come up with policies that support road safety in nature. And if you brought somebody from UNBS, the same would happen. But this engagement has to continue. And when you come to maybe mechanical condition of vehicles, there's a lot we can still do, and I think we're discussing with the ministry on how we can regulate the garages, mechanical garages for vehicles, because we find that even they lead to a certain percentage of crashes. You find you've taken your car for replacement of a part, but it's not replaced. And this is happening in most garages. Or they pick from one vehicle to another vehicle. They pick an old part to another vehicle. We call it cannibalism in KCCA. Mm-hmm. But no one's regulating these, or we've not regulated them enough. And if a car has no seat belt, what should a mechanic do? Or should they let it out? Will it affect the mechanic's credibility or credentials if they let out a vehicle that is not in good condition? There's a lot that we've done, a lot of groundwork that we've done. For example, inspection of vehicles, starting with public transport vehicles. But as we continue to do this, I think we can simply acknowledge that there's always room for improvement. And as we go along, any contributions or any innovative ways that people can come up with are really welcome to the table to be able to sort some of these issues out. Thank you.
Thank you. I hear you. And talk about motor vehicle inspection. You know how SGS ended up. But I also know, for example, in addressing the collapsing buildings, I know that the National Building Review Board has come up with how do you call them? Engineers that are accredited by them. So if a building collapses and they check which engineer was on the building, they're able to tell whether you use the fake engineer or the one that is on the list. When you talk about regulation of garages, I really hear you, because most of these guys who actually give our vehicles, sometimes they have not even gone to school, but they know how to connect a wire to a wire and the thing moves, and then we think we're safe on the road. So I really look forward to that intervention if it ever comes into place, because garages...
Be hopeful.
I am hopeful. It's Kampala. I'm hopeful. Roland, quickly, what are the opportunities that do exist? We're obviously not going to take people out of Kampala and rearrange Kampala. We have to rearrange it as we live in it. What opportunities do exist in terms of the interventions where we can quickly put things together and sort of create a city that we actually all want to live in with reduced road crashes?
Some of the opportunities include, I think we have to be realistic in how we plan as dwellers. I mean, from the developer's point of view, I'm talking of the likes of KCCA, UNRWA, and maybe Ministry of Works. If, say, there is a problem of old vehicles that cause crashes, and you talk of garages, why don't you have them certified, and the personnel or the mechanics therein meet certain training standards for them to qualify to be called mechanics? Then two, if you, on average, Kampala has about 500,000 motorcyclists, and my brother Kananura said they have about 900 traffic personnel. So how do the 900 personnel handle the 500,000 cyclists in Kampala alone? You find that on average, one traffic officer handles over 500, which is next to impossible. So I think if we very well know that there is a problem, we have many motorcyclists, then there should be an intentional effort to increase on the number of traffic personnel. And then three, the other opportunity is that there's always been a case of non-trained drivers where people acquire driving licenses backdoor without going through the recommended system of, say, go to driving school and then you're tested, go to IOV before you're issued a driving license. So I think there is need to get rid of human-to-human interaction and let people interact with machines so that we can have an increased number of trained drivers on the roads to do away with issues of corruption and stuff. Yeah. Thank you.
Thank you. Quickly, then we get to the plenary here. I want to understand from you, can you elaborate on the strategies proposed for sustained long-term campaigns to influence behavior change? And also, what role these campaigns play in achieving road safety objectives?
The first thing is maybe the reason that we came up with a national road safety plan was because there were many campaigns, but they were disjointed and they were ad hoc. There was no complete plan. Now, in this room only, we have all the players that have an interest in road safety, and they have a lot of imagination of how they should do this. What the plan did was to provide Ministry of Works as a coordinating entity and to ask all these plans to be submitted so that there is a coherent and sustainable way that they are done. Rosaku has presented a number of proposals, and they are long-term proposals, okay? We have the school zones. We have something to do with the border helmet use. Basically, they pick a component of each law that you bring on place, and they look at the way this can be disseminated, sensitized, implemented, as well as monitoring and evaluation. Now, to me, yes, there's a mechanism where all the players can provide their plans, and the ministry will find a way of ensuring that there are no overlaps, okay? But also, the extra thing that especially the civil society and academia can do is do some monitoring and evaluation, do some research on how these have been implemented and the impact of all the mechanisms that we are putting in place. That way, whatever we do following what we have done, assuming this is the best year, we'll be informed and we shall have improvements at all levels.
As long as we're tracking the progress.
As long as we are tracking. And look, we are working with data.
Okay. Yeah. Talking about data, someone just sent me a link here saying numbers don't support drink driving crackdown. That when there's crackdowns by police on drink driving, it does not necessarily indicate that there's going to be reduced road crashes. Is that true, SP? The numbers do not support drink driving crackdown, or maybe it speaks to why we need to be more innovative in terms of the interventions. That as much as police does these operations on drink driving, they do not necessarily lead to reduction on road crashes in that particular period.
What method has that person used? I don't know.
They compared the statistics from the police annual crime report and the factors that are causing road mishaps do not tally. Anyway, we'll review these statistics later.
I really don't agree with that person because probably would have more numbers registered than what has been presented. Really, drink driving, when people drive under influence of alcohol, really it causes crashes.
Yeah, but they're saying that the numbers here record show that most crashes occur due to careless or reckless driving. The second is dangerous mechanical conditions of vehicles, but not necessarily drink driving. They have the list figures. That doesn't take away the fact that police is doing a good job.
Now, but of course, it is also when crashes have happened, it becomes difficult for us to have the record, to have the proof of, like for example, how do you now take the body to test if someone is dead and he was drunk while driving? How do you test that body to prove that the person was? But you could have also noticed how we have started also testing the drivers of buses, and surprisingly, we are finding some people drunk while driving these buses. Yeah, recently we were getting some as they enter Kampala on our checkpoints because we have decided now to start testing them on checkpoints, the bus drivers especially. So some of them are drunk, and when we talk of actually drink driving, we tend to forget about the drugs. There are even people who use drugs, marijuana and other things. Exactly.
Okay. Let me invite Dr. George Didi, who is a Member of Parliament for Bongi, on behalf of the Parliament Forum for Road Safety, to speak to us. I want to put this question to you. Considering the 2020 target to reduce global deaths and injuries from road traffic crashes by half, in your own opinion, what role, for example, can you legislators play to bring this to a reality?
Yeah, thank you, Canary. Ladies and gentlemen, Dr. Boka Didi George is my name, Member of Parliament of Bongi constituency, a member of the Health Committee of Parliament, a member of the Parliamentary Forum on Road Safety, but also a member of the Public Health Accounts Committee. A pleasure to the conveners, the facilitators, and the panelists for the engagement on this important subject matter of revolutionizing the road safety situation in Uganda. We've looked at the statistics amplified by the Ministry of Health that puts road traffic crashes and injuries related to it to the fourth in a burden of diseases. And currently, I'll be interested to see these numbers disaggregated by region, by district, and possibly by community for us to take the debate on road safety issues and concerns to the citizens. Number two is that we know from the conversations that the deaths, the injuries, as well as the disabilities and the loss to the economy associated with road safety, road crashes, and deaths therefore are driven by risks. There are human risks caused by knowledge, attitude, practice, and behaviors of our citizens. There are machine risks that have been amplified or highlighted, but we also know that there are infrastructural development and technology risks, as well as environmental factors. These need to be understood by the citizens, and this requires us to have a multi-sectoral, multi-stakeholder, and multi-level engagement. The conversation now in Kampala is sweet and nice, but it's a boardroom conversation. This conversation needs to be taken to the regions. This conversation needs to be taken to the districts, and this conversation needs to be taken to our communities, as well as putting households and families at the center of the prevention and control of road traffic crashes. Having said that, I want to emphasize the need for us to up our game in public education on the burden of road crashes and its implications to us as individuals, to our families, to our communities, and as a country. Let's take the conversation to the households and families. In our social behavior change communication, Mr. Kandri, I thought it would be very, very important that we broaden this conversation beyond the Ministry of Works, beyond the Ministry of Health, beyond the police services to the community-based services coordinated by the Ministry of Gender, Labor and Social Development. And this is the ministry charged with the responsibility of social mobilization in this country. Two, we need to take this conversation to our schools, nursery schools, primary schools, secondary schools, universities, where majority of our citizens are. The school community needs to be involved in this, and this possibly will have to find a space in our curriculum system. Looking around, I haven't heard anyone from the Ministry of Education involved in this conversation. We need to integrate this conversation in a school health policy, possibly, so that our children are aware of what to do in regards to the prevention and the control of road crashes. Having said that, specifically coming to the role of Parliament in all this, we have 5 key roles currently. Our role number 1 is creating an enabling legal and regulatory framework through legislation. And my chairman, in his opening remarks, did already allude to the fact that we have a number of pieces of legislation that are in place. Our ground norm is the Constitution of the Republic of Uganda that urges us to protect life and property. And let's look at the issues of road traffic crashes and injuries as issues of human rights. The Bill of Rights addresses that. There are sector-specific pieces of legislation that need to be put in place. We already alluded to the Traffic Act, the Road Traffic Act. We've alluded to in the Public Health Act, the addressing of issues of emergency medical services. But also, just within this week, we're in a retreat of the Health Committee of Parliament, looking at the Good Samaritan Act is long overdue. us to be able to respond appropriately at the site of accident, on the way, in the health facility. All these are areas where we need to ensure we have an appropriate legal and regulatory framework. How do we address this as Parliament? We address them through the appropriate sectoral committees of Parliament, through bills that are initiated by government or private members. And as members of Parliament, we are ready to address any lacuna in the law. Our second role country is related to appropriation. And that role basically means ensuring we have sufficient and necessary resources allocated to support the ministries, departments, agencies of government, including local governments, to be able to execute their role of promoting road safety, of preventing road safety crashes, of ensuring progressive delivery of quality services in the response centers, whether community-based response or facility-based response, to ensure victims of road crashes survive. At the primary health care level, at the secondary care level, at the tertiary and super specialized care. And this requires ensuring we have sufficient resources for a systems-wide approach that requires addressing issues of governance, leadership, and management, and coordination of efforts in a framework that require ensuring we have appropriate infrastructure, that requires ensuring we have appropriate tools, and these tools are being used by qualified people that have the knowledge, skills, competencies, and the right work attitudes to respond at community level, at facility level, and on the way. I'm happy as government, through the Ministry of Health, there has been a progressive appropriation of resources. The Emergency Medical Services team already put their prayer to us as the Health Committee of Parliament. How do we ensure resources are allocated? Number one, our prayers here should find a place in the budget framework papers. And I'm happy that this conversation is taking place when we expect the budget framework papers to be laid on the floor of Parliament. The issues on road safety included in the Ministry of Health budget framework paper, that's the responsibility of Maria. With the permanent secretary, the commissioner, and the minister to ensure what we need to invest for service delivery in responding to road crashes is put in the budget. The same applies to the other ministries, departments, and agencies. Two is through the ministerial policy statements that have to ensure the gaps that we have identified here find a place in our ministerial policy statements in terms of prioritization of action. Thirdly, will be in the indicative planning figures. I've been looking around to see whether or not people from the Ministry of Finance and Economic Development that issue the indicative planning figures. So it will also be important that in future engagements, we bring on board the Minister or the Ministry of Finance, Planning and Economic Development, as well as the Budget Committee of Parliament that does the final scrutiny of allocation of resources. Once we have appropriated resources, how do we ensure, out of, for example, the 3.6 trillion that we have appropriated for health in this financial year is utilized well, efficiently, economically, and reflecting value for money for the 47 million Ugandans. That takes us to our oversight role. Last week we were in Ichigezi, and while in Ichigezi, one of the areas that we're looking at is to what extent are we improving access to emergency medical services. Our prayer would be as the Committee on Health and other appropriate parliamentary committees is to ensure Ministry of Health, Ministry of Trade, Commerce, Industries, Ministry of Internal Affairs, Ministry of Transport, we have a parliamentary checklist to help us ensure adherence to standards at the point of care, at the point of service delivery. For example, around lunchtime, Mr. Canary, were having a conversation with a stakeholder from the Uganda Bus Drivers Association. And I asked them a basic question. Well, do we have a school in Uganda where we train bus operators? The answer is no. And yet we have drivers that ply our routes. Where are they trained from? Who certifies them? Who ensures they comply with the minimum standards of driving? It's an issue that we need to address, and that's part of oversight. Beyond oversight, our third role is the role of representing you, the citizens of Uganda, in the floor of parliament. How do we do that? Number one, if there are issues that require you, the citizens, to petition on road safety, you have the opportunity to raise that to us. Number two, if there are issues that require moving motions to urge government to take action on policy, on strategy, on allocation, on compliance, you have the opportunity to raise these issues that we can then package in the form of motions that we can lay before Parliament, and it's debated, and we urge the executive arm of government to take action on what you want to be done. Currently, the other option is raising matters of road safety as matters of national importance. Matters of national importance. This you can do through the Parliamentary Forum on Road Safety, you can do through the Health Committee, you can do through the Committee on Infrastructure, or any other relevant committee of Parliament. That's our role in terms of representing you. But finally, we are advocates. We speak for the 40 million Ugandans. For us to be able to exercise our role of advocacy effectively requires us to get our facts and figures and statistics right, so that when we are doing legislation, it's evidence-based and evidence-informed legislation. When we're doing appropriation, we needed to have shared the statistics about the financing to the road safety program in this country, what is expected, what has actually been provided, what are the unfunded needs, so that we know in specifics and evidence-informed the trajectory of financing for the road safety program in Uganda. So we need to invest in generation of evidence. And that takes us to the engagement of the academia and research institutions and innovations, the role of ICT, and broadening our digital footprint on matters of road safety, which will be linked to the theme of revolutionizing the road safety response through the adoption of appropriate technology. I thank you so much.
Thank you very much, Honorable. You highlight a number that maybe next time need to invite more stakeholders, especially those, when you talk about funding, we have the people who are responsible for that. But Maria, you wanted to correct a figure that you spoke earlier on what?
Thank you so much, Dr. Boka. You know, when he's in the House, I don't even need to speak about road safety issues as Minister of Health. He represents Parliament, but he's also very passionate about the sector where he comes from, as regards especially financing. Thank you so much. I wanted to correct the figure, the statistic on the burden of disease. When I cross-checked, it is now the 5th, not the 4th. So quote me right, because this normally goes out, and we have to be as exact as possible when it comes to statistics. It is the 5th leading cause of death as per the financial year 2022-2023. Thank you so much.
Thank you. And now to you, let me pick maybe 2-3 comments before we go for lunch. Yes, Pam, someone take me the mic.
Thank you very much, Canary. To clarify on someone's question that came in, I think, on social media about drink drive, in relation to the statistics. Drink drive operations are normally preventive, not after. Although we register some crashes which are very minimal after as a result of the driver driving under the influence of alcohol. So I wanted to put that clear. That's why it being preventive, we have very few numbers of crashes caused by driver driving under the influence of alcohol. Then secondly, since we are stakeholders from different areas of road safety, one of my points of concern as police, one of the challenges we face is evacuation of victims of road traffic accidents. We all know here that the moment a crash happens, what comes into the minds of the wananchi is to call police. Police will diligently show up with a police patrol pickup. So if you have a head injury or a fracture or maybe multiple fractures sustained by an individual, I can assure you by the time you get to Mulago National Referral Hospital, chances that you'll be alive are very, very minimal. As a civil society, can we explore indulgence in that area? We are having a big problem as police. That is why some of the statistics we have of victims being injured, it raises the fatalities because of the mode of evacuation and probably response time. But our challenge is then evacuation. So you find that maybe a taxi has crashed. Those are about 14 passengers on using one pickup. It's very challenging. So can we explore that area? Then, as I conclude my humble appeal, we are talking about border riders, blah, blah, blah. We are leaving out some of a particular category of some of the biggest road users, drivers of government vehicles. We need to have a very honest discussion. We are leaving them out, yet they are the biggest violators of traffic rules. So since we have the Honorable Member of Parliament, please take our plea to the ministers and the big people that the law applies to all of us equally. And since road traffic issues, when we are trying to sensitize, we also emphasize behavioral change. It is very difficult to preach water and drink wine. We expect the wananchi to comply, but then on the other hand, the people that we are as government are not complying with even what you're legislating in Parliament. So are you wasting time there? Are we dealing with a problem? Are some people too big to be part of this? Maybe next time we have such a gathering, we need a bigger number of ministers. We also implore them to prevail over their drivers. Sometimes, many a time when I see such convoys drive past me, I wonder how the principal in the car gets to his office or her office seat and has a very sane mind that he or she has gotten to office after pushing off several people off the road. Some of these things do not need to be legislated upon because it's even impossible. It is difficult to legislate over someone who is bad-mannered. It's very difficult. And maybe also, to whom much is given, much is expected. Many of us in government, we are given a lot. But to deliver on the expectations, I don't know why we find it very difficult. Even on the basics, such as just road discipline. I don't know what they lose when you're able to sit in traffic for maybe 5-10 minutes. Because we are all on the road, heading to different, no one is idle on the road. No one is idle. So, Honorable, please take this plea that need them also to adjust on their behavior so that when we are speaking to very many, like we are speaking across the board, because it's very, very difficult. As many of you have witnessed, you find like say Chira Road, that stretch from Bukoto to Chira Road Police. You find all the motorists are in line. Then out of the blue emerges a convoy on the other side of the road, all the way down the traffic lights. And then you're wondering, is it a machine in there? Is there a human being really who is not seeing what is going on, who is so detached from reality? So let us not leave out some of these biggest traffic violators as we speak. Yes.
Thank you, Pam. Very, very honest there. On evacuation, by the way, I think that we need to do training for corporate companies. I hold a certificate in first aid, yeah, and I know what to do. I know how to tie the tourniquets. I know how to handle fractures. I know how to do that. But if corporate companies, I guess, should teach their employees, still on the same table, Baguma there, we'll go around. We'll get to all of you.
Thank you very much. I don't know whether Superintendent of Police Kentaro will still be in traffic police at the next meeting. But I want to congratulate her for being this straightforward. And I'm saying this because I get post TV or radio appearance calls, even this morning when I was at NBS I got. But the one where I have got the highest number of post appearance calls is where we are talking about drink driving and traffic. And it manifested in the room today. The only issue that Canary picked on, response from the was drink driving. It tells you the power of the alcohol industry and how it interferes very strategically with the work that we do. If any of us has ever been drunk, you know that when you are drunk, there is no contradiction with science. You are not properly coordinating. And you're on the road. That is indefensible. But let me move what I wanted to say. It is important, I think, as an advocate who has been pushing for causes, it's critical that we acknowledge achievements. It is oftentimes that we go and we spend 90% of our time talking about what we have not done. And sometimes we take the thunder out of our ability to build on what we have done. And I think it's important that we build on our achievements. I think this country, and I have traveled on delegations for road safety, we are acknowledged, for example, in the area of legislation. And we need to thank Parliament, both the forum and all of you. You really have gone against the road a big tide. Let me tell you the second thing. We moved from a budget, I think, of 900 million for road safety in the Ministry of Works to 5 billion shillings. If you put it in percentages or even in times, really, we have moved. It's small, but we must accept that we have done a great job. The other thing is convening. Mr. Chairman for Rosaku, you have been in road safety for more than a quarter of a century. But when did we have the ability to convene the way we are convening? We must thank ourselves and build on this. When we don't do that, even the people who support us don't have the energy to come. You go to the World Bank and you don't tell them the journey you have made, but you want them to give you more money. How? So Canary, sorry, I am taking the other side, but I want to encourage ourselves that we have taken very important steps. We need to build on them. Finally, we fear to talk about the root causes of the problem. Somebody said, how do people get convoys? How do musicians have musicians? No, presidential advisors, those are advisors. How do every Mpenkoni driver have lights in front of him? So really, we must talk about the source. And this is the political office holders. They are the ones who override the technical people. My friend, my young brother here, Kanandra, will receive one call, and Kanandra will shrink. And they let the cars go. Why would Kanandra, young as he is my young brother, by the way, why should he risk his career? You go on the road and all your vehicles knock each other and make corpses. We shall keep counting the corpses. So we must talk to the high-level political decision makers, the people who hold power. And when we get into these rooms, we all fear to talk about them. Today I was talking about them. I said the border problem stops on plot 1. Why? I have been involved in distributing borders given by the man who sits in plot 1. How do you talk about them? And then when I came off the phone, somebody called me and said, Baguma, you tone it down. Because the campaign is coming, we are going to distribute more boda boda. Thank you very much, Carlos.
Thank you, Baguma. Yeah, please move around the table. I wish everyone is that straightforward and brief, so we can be able to pick as many comments as we can.
Thank you, Kanai. My name is Katabazi Isaac. I'm the Vice Chairman for Truck Drivers in Uganda. My first question will go to Irene. Congratulations, this is the last time we met. However, you said about you've been communicating to border boarders and bus drivers on TVs and radios. But I think that's a wrong measure to reach the border boarders and the bus driver. By the time you're on TV, maybe the bus driver is on the road. I don't think so applies to the border. And secondly, you say that you are putting on signs in Tinda and areas and everywhere where even there are humps. So don't you think that you could also divert the same funds? Because already nobody can go over 30 on the bumps. You could also use that maybe on the northern bypass. And to Maria, you say that the visual testing to public transport drivers. As a leader of truck drivers, where I find that we truck drivers, we are, I think, the most disciplined drivers on the road, that other people can bear me witness. But still, you see that if you are going to be visual testing only the public transport and us as long distance drivers, don't you think that the personal drivers, you are leaving them behind when even they are the main cause of accidents in Uganda? I think first we should also try to know where the fatal accident starts from. I think it starts from those people who can get money, buy his car without even a license. Tomorrow he gets a license and he's on the road. Secondly, Kananura. When you said about the operation of borders, when you are getting them off the road, I can also feel the pain you are going through. Because even recently, you saw even on the platforms where a border came under a trailer through the jam because he was being chased. And that was totally risky. Yeah? But the man who was chasing him insisted even going him under the trailer also to catch him. So there was going to be also two bodies at the same time. I think you should also train your officers whereby not to go into the same dangers. One has gone in the trailer and even the other who's trying to catch him is also going under the trailer and the trailer is moving also. Yeah? In fact, I think those people should also be trained where and when to get the same people. Finally, the parliamentary forum, you say that if we have issues to raise towards the petition, kindly, for us as drivers, we do have a serious one, insurance. You see, Uganda insurances only cater for the third party. They don't cater for drivers, as if drivers were left like dogs in any accidents where a driver is involved, leave alone he is the main causer or not the causer, there is no insurance which is covering him. You can also see another insurance policy of comprehensive. Comprehensive also does not at any way go to a driver, neither the third party. So for that reason, you could also, that's our petition maybe, we as drivers, tafadhali, can you kindly put some little policy so that it can cover the insurance people can also bring some money to us, because we are also the major people who give them money, because they are getting that money from what? From the vehicles. Thank you.
Thank you.
Thank you. My name is Ibrahim Kayondo, United Bus Drivers Association. First, I thank an Honorable MP and the Doctor to talk about the bus driver? Where does the bus driver comes? I've been asking that question, me, myself, for more than 20 years. We are talking of a doctor. We know where a doctor comes from. But where does the driver of Uganda comes from? There are no schools. For us, when we tried to figure it, in 2004, we were assisted by the late Honorable Minister Wasieba Wanjusi. He wanted to build us a school, a driving school, and give us a training bus for bus drivers. He was alleged that he stole fuel or whatever of the road. Then they put him out of the office. That is where we ended. But Honorable, I request, please take that question in front of the committees you have mentioned about, which are many in the parliament. Where does a driver in Uganda originates from? Me, I am lucky. Honorable, I drove on your route, northern route, since 1982. I was a driver, driving with a bus called Northern Bus Company. The owner of that company was from Lira. I think you were also still young, maybe. But I was driving you. Now, from nowhere, I became a driver. Even I did not stop on that. Are you aware that you are talking or you are looking at someone who presented East African countries? I'm the one who led the team for the supporters of the World Cup. I went up to Johannesburg, me, myself. I was leading a contingent of 40 buses. But where did I came from? So that question, Honorable, I beg you go with that question. But as you have been asking from Maya Fund, we are doing a sort of whatever related work to see that we can put something in place, even though there is no school. Me, secondly, I studied in Kariako Driving College in Dar es Salaam. That is where I acquired a diploma in driving. I have the certificate. I have everything. If needs be, I can present to you in your office. But through struggle, no system, no what, then the second thing, Honorable, you should talk about behavior. Behavior change in Uganda, if the generation you have now is not changing its behaviors, we are nowhere to go. I can't talk much with behavior. Honorable, you know what is happening in the house now. I'm sorry to say that, but you know. Now, what do you expect these road users? What is taking place there is what taking place in the whole country. But we should ask, let Almighty God change our behavior. Thank you, Doctor, to listen. I think you have quoted them. Now, I want to remind my engineer from KCC. You can recall I was with you when we were launching the yellow boxes in our roundabouts. Because you have been somehow, in leave, but I'm here to inform you that all those boxes are washed out. They are no longer there. And to make the matter worse, that one near our big house there, Parliament. You meet the cars packed in that box. What does it mean? and is the where you pass when you are entering your office. Thank you.
Thank you very much. Thank you very much. I'm called Patisingoma from Ureno. My question goes to Maria and the police. I wanted to know whether Uganda police follows victims and who are admitted in hospitals and who die, and how many days does police follow up the victims who are admitted in hospital. Then the second question is about the standards. Again, this goes to Maria. What are the standards of the ambulances we have in the country, and does the public really know these ambulances? Because when you look at the ambulances that many members of parliament procure, they are basically vans fitted. They may even not have a fire extinguisher. They're basically vans with a bed and a stretcher. So we need to know whether there are standards for these ambulances so that the public can know what to buy. Now the third question goes to KCCA. Does KCCA help the other cities and maybe Wakiso in planning so that they can do better than them in future, or do we wait for these cities also to have the same problems that KCCA is facing now? Thank you.
Thank you. Let's move there to the gentleman. Okay, yeah, sure.
Yes.
Yes, sure.
Thank you, Kanare. I'm Mujun Dixon from Boda Boda Industry, Uganda, and as well as a rider. I would like to inquire, last year we had a campaign about Boda Boda. It was Ministry of Works and Transport, KCCA, Uganda Police and UDISA, where they trained. It was a massive training and registration of our Boda Boda riders. It was quite a good project, and most of the riders had complied. I don't know, why did it stop? This year we haven't seen it. I would like to understand why. Another question is, it's so worrying that we are receiving a huge number of deaths, 400 to 600, and in that I actually say maybe 200, over 400 are Boda Boda riders, and which is very sad compared to the cost of the surgical operations that are carried at the current status. I would like to ask, what has Ministry of Government put in place in aiding that, actually all the ministries, in aiding that these Boda Bodas do not actually exceed? Because normally when you see the cost, an ordinary Boda Boda guy cannot access that. And that's why we are seeing right now a number of Boda Boda guys are disabled. They are disabled, they are amputated because they do not have that money. So it's very sad, and this is a bad image to our country because our people are being, I don't know. Another thing is, we wish to have, like in a Boda Boda sector, a post-crash care, because most of the accidents, the first responders are Boda Bodas. But how about if we equip them with the knowledge how to handle somebody after having sustained an injury or having got involved in an accident? I wish it will help somehow, because most of the, as Madame Maria said, these victims reach at the hospital when maybe things are spoiled at the first sight on the handling and whatever. It's my prayer that we champion to see that these Boda Boda guys are equipped with that skill, because they are ever there. At any time, they are there, but they do not know what to do, and they cause. Another thing is, please help us on the substandard products that are on the market. Most of the roads, most of the accidents, if you see a Boda Boda, there's some time back, Fande Kananura, they released a footage where a Boda Boda guy came from nowhere. He knocked a car of Ua, and even he had collision, both of them, a border to border. You see a collision, a border to police patrol. These are always comes with the problem of the counterfeit products on the market, especially the brakes. The brakes and the nature of the helmets right now. If you see somebody buys a helmet of 30,000, it's going to last for 2 days, and this is the helmet that falls down and it breaks. If we see that the ministry is champion to see that we phase out these fake helmets. But I do applaud and congratulate the effort that the government has invested in much, seeing that the border guys are. Another thing, lastly, is the border loan schemes. One minister said border guys are mad. Indeed, they are mad. They are mad. Somebody wakes up in the morning, he gets a loan of a border worth 5 million, but he starts to pay 12 million. A border 12 million. And at the moment they arrest him, he's penalized. We have these guys of Mogo. I don't know what the parliament is helping us to do. You will see a border rider riding, not because he wants, but he wants to see that he pays back. So at the end of it, you have found that they have got an accident. Remember the accident where this guy, a safe border guy, was killed at Mukwano roundabout in that operation? Those are things we are suffering from. Thank you very much.
Thank you. There's a gentleman there, and then we come to this table, so we conclude. There are two there, and then two here. Yes. I don't see the ladies.
Thank you so much. Allow me to talk quickly about, I want to represent the training side. Because much as we are saying we don't have sources of schools and whatever, I believe, because I started driving in 1984, and I've been on the road driving small cars, big lorries, and the other big vehicles, working for departments and personal individuals' vehicles. I am very happy. Since we started, and since I belong to Rosaku, I have seen many developments, much as Waguma was saying. The legislature is doing what it's supposed to do. Law has been amended. Thank you so much. But there are some sides which are being omitted, much as we are on the field. For us, may I say, we are much on the field, and we expect much to come from you people who make the laws. Some laws seem contradicting, and they are putting too much load on the police and we who train. Because somehow I train. I am a chief instructor. I worked with UDISA, a company which we thought would have actually came as a savior, but we don't know what happened, because it had lorries, it had buses, it had every type of vehicle, but we don't know where the UDISA is now. It stretched up to Mbarara, it stretched to other sides, and it had branches. We thought it would heal us. So training would not be the problem, because driving is an art, it is a craft, it is actually an individual's personal thing which needs improving. Now, when we get opportunities to come to such symposiums and meetings, I think we are supposed to look for solutions, not pin on problems, because we already know how many problems we have. I would suggest, if in the law you could include that all officers, because there are things we cannot avoid. The three major things I'm looking at as problems: speed, drinking, and other distractions and obstructions like phone and what. I am saying, for me, in my opinion, let the law include that all officers and older ages, elderly, not drive themselves. If it can be a law, then the permit and the points, that law would work better. Because now the points, it is me having the permit. It is my permit that would be subjected to subtracting the points. So if we are talking of professionalizing drivers, and we are there to help them to become professional drivers through defensive driving techniques, and we are trying to give them, then officers, because they cannot avoid drinking, some of our officers Because I'm sorry, I could have mentioned some of them who are actually drunkards and they are officers and they can really manage to drive themselves because they want to do it. But if it was law that says an officer must have a driver, especially on long journeys, then we would expect, because much of the accidents that are fatal are on highways. In fact, we suffer, the people who come from Kampala now during the Christmas time and the Easter seasons, they tend to go on the highways. And these are the people who suffer, who get more accidents during such seasons. Because they have been here driving at 40 kph, they are driving at that slow speed. But when they stretch to the highways, they find problems. They stretch and they have got big vehicles. So that's one side of it. Because we are saying, let drivers have professionally trained, but let them have jobs so that they are strictly responsible for their permits and for the points that will be subtracted. So that if a drunkard officer can drink, let him go to a party and he enjoys his time, but he does not drive. Okay. I was of that opinion.
Thank you.
Yes, then the training, again, I'm saying let the government emphasize that all departments ensure, especially this with public, because when I talk public, I mean borders included, I mean taxi and buses. Let's see that they ensure that their companies actually offer their drivers to be trained. We have moved to them. We have requested them to train them in defensive driving and actually refresher courses to give them even freely, but they are saying they don't have time for their drivers to go for such trainings. So if the government can say, maybe either they be a certificate recognized and we just issue that for the refresher courses, maybe our drivers can really improve on the discipline. Because this is not a problem of training in schools, it's a problem of discipline and character. Thank you so much.
Thank you very much.
Good afternoon, everyone. My name is Joseph Kato. I am a journalist and I can say a road safety activist. For some time, I've been reporting about road safety, and sometimes people tell me when they say story popping online, among the first names they think about who could have written it is Joseph Kato, because I've written so many about it. But my question goes to the two superintendents of police, that's SP Pamela Kentaro and SP Kananura Mike. I would like to know why the police reports, even if I have like 5 of them on my phone now, for the last 5 years, they don't capture the number. We capture the number of people who have been killed in road crashes, but we don't capture the number of people who have been prosecuted for killing those people. We had 4,500 people killed in 2022. We don't have the number of people who are prosecuted for killing those people. We have 15,000 people who sustained serious injuries, but we don't have the number of people who are prosecuted for killing those people. But we have the number of people who are arrested and fined. It is as if we are prioritizing fines at the expense, rather the option of prosecuting these people so that they feel the magnitude. Who has ever been in jail? Who has ever been in jail here? Media journalism, I do has led me to jail. But I'm telling you, if you spend 2 hours in jail, just behind the bars and the people are looking at their strangers. And what if you are prosecuted and remanded or sentenced to 3 months in jail? Then you paying a fine of 200,000. Tomorrow, the 1 week you spend out thing, your children, your wife, your family, just confined in a small place, it will have impact on your behavior on the road than the fine of 200,000. Thank you.
Thanks, Kato.
Thank you very much. Mine are questions to everyone. How many cars do we have in Uganda? And we know the population is about 45 million people. But then as we are designing our roads, our priority, even for KCCA, is vehicular traffic. And the pilot we have of Namibia that caters for everyone is just one. So why are we designing roads for vehicles that are few? At least, I don't know how many cars we have, but I think maybe 2 of every 100 Ugandans own a car. But the roads we have are for vehicles, are not for other people, the vulnerable road users, the pedestrian, the wheelbarrow pusher, in Kampala or in Uganda, if you move in a wheelchair, you actually move in the carriageway because you can't access the pedestrian infrastructure where it is. So we need to think through how best we can prioritize the majority democracy. The other thing is we are discussing road safety, and I think we can't, if you're talking about road safety and people are driving because they have no option, then we need to have discussions on multimodal transport. It's a critical component of road safety that we shouldn't skip. The other thing is to do with post-crash care and our third-party regulation. I think for every crash event, if I knocked someone, that after that lengthy process, they are compensated up to 1 million Uganda shillings. I can be corrected. But then that law, I think, came out in which year? Maybe 87 or before that. But then what is the cost of treatment here? So our members of parliament, the third party regulation, the law in Uganda needs to be looked into and brought up to date so that we sort of, it could contribute to the medical bill, but also help out with caring for the victims. I submit.
Yeah, thank you so much, Karen, and with the rest of you who complimented on a number of issues. One, of course, I would directly go to the questions which were directed to us as police. Someone talked about a traffic officer who chased a border up to the under the trailer. Of course, every time we are going for these operations, our officers are well briefed, but of course we all know human beings. We all know that. I may not really spend much time on that. I think some of them also get to these operations and also have their personal things. And besides, I think next time we shall organize something where we shall also invite you people to some of these operations, and you see what we go through. So I think this office also somehow, somewhere, the wires went off and is inside. But of course, we don't encourage that. We don't encourage that. We really we condemn that. And every time we have to send them, we brief them on what they are supposed to do and what they are not supposed to do. However, I want to add on that passengers who are taking up these motorcycles, please, if we come out and announce and say we are going to carry out operations of those borders without crash elements, then don't risk also to get a border who does not have a crash element, because you know that you'll be fearing traffic and probably will run up with you and then you don't know what follows next. So let's help each other in this. On whether the police follows up the victims of accidents, of course, yes, somehow. Of course, to a larger extent, actually, because for purposes of prosecution, we follow up these cases, and we are all aware that victims of accidents, for it to turn out to be fatal, it has to be a period of 1 year. If someone dies within a period of 1 year after an accident, then that is fatal, occurring from the crash. Then beyond that is something. So we continue monitoring some of these crashes. But of course, when we also expect much from the relatives of these people to keep on updating us. And then we also have to admit the fact that our sources are very much limited. We are limping in enforcement and others. Then now again, we have more funds now to continue follow up some of the victims. So it is a bit a challenge. So we sometimes rely on the relatives of these victims to keep on feeding us information. And then also for purposes of prostitution, like I talked about. My friend also talked about on why we only talk about the death, and then we leave the people who are being prostituted. I don't think that you also you are in disagreement with what we are doing to talk about the numbers. Actually, these numbers, it is also a tool for sensitization. We could have also all seen what was happening in COVID. I saw the more the numbers our friends in Ministry of Health were talking about of the death from COVID-19, then the more people will become more conscious, put on masks, wash their hands and follow all those rules to ensure that they are not victims. So the more we do this also, it keeps on really informing people. And people have really not fully conceptualized road safety. It's only us who are here and a few, but people up to today. I really want, if we can get to situations where when we get to parties, when we get to churches, mosques, road safety must be talked about, because really it is claiming lives of people. And some people don't mind about it. They only way to become victims, and then they start saying, had I known. So let's not wait for that. And when we are giving this information, it is a tool for sensitization and alerting members of the community that please be aware, this is what is happening. We are losing 10 people per day, so please don't become a victim. And everyone, of course, is a candidate of a road crash. We must understand this and know it. But of course, also you have a good point that we need also to look into on how best we can also start talking about these people who are being prostituted. You could have also realized recently, we have started the name and shame. And I think it has also worked for us, and it is going to work for us. We are looking at these big shots who are violating these traffic laws and regulations. We capture their videos. Some of you are the ones who take this video and share with us. Then now we start saturating them. And it has worked for us, by the way. In panic or in fear, they have sent their drivers very fast before we arrest them. They have come and complied. Some have been taken to courts of laws and been given express penalty schemes. So let's also continue using this tool. It will help us. What we only need from you is please to share with us this information. We cannot be everywhere as traffic officers, but we also rely on the members of the communities in some of the things through information sharing. Thank you.
Thank you. Can the rest of us wrap up in one minute each? Engineer?
Thank you very much. I'll just address some of the issues that were raised to me quite quickly. And the gentleman from bus drivers, I'm going to get your contact after here, and then we'll organize an engagement with the bus drivers, at least those that you can get, to sensitize about road safety, in particular the road measures that we have put in place that are currently apparently new to some of the drivers. So I'll get your contact. I see Mr. Kayondo shaking your head, but you know that we did this with you, and I hoped that you'd pass that on, but he said he was a truck driver, so I'll go for the truck drivers and bus drivers. Thank you. And also, yes, I noted the issue of the washed away yellow boxes, and we are going to replace those and some others at other junctions. Also, yes, my colleague there, Cuthbert, asked if we help other cities. We do help other cities, and just before I went on leave, we had an engagement with Ginger City, and we shared a couple of things, including road safety, transport planning, public health issues, and then also gender issues. And I actually led that procession, and yes, we do. If we are approached, we always open our doors to them. We haven't gone out directly to organize maybe forums like this, but that's something that we can look into, that we can take on. I cannot promise, but it's something that we can look into. Then also the training of border riders that happened last year. I think we had a bit of laxity on this, but we shall pick it up. Now that I'm back, we'll pick it up and see where we can start from. Also, the NMT facilities, yes, Bonnie. I'm actually feeling quite happy with your question today. I think the last forum we're in, I mentioned to the people that were there that we ask for the wrong things. We are asking for the same things, and sometimes we're not getting the answers because people do not understand what we are asking for. Now that we have our parliamentarians here, we need to ask for mass transit. You're right, because mass transit answers the question of road safety. I'm going to address one driver who is carrying 60 passengers. I don't have to address 60 border men. And that logically should make sense to everyone. However, oftentimes when you're asking for motorcycle safety, how many motorcyclists am I going to train as a person? And yet I can train 100 or 200 bus drivers in a short while. mass transit answers the question of road safety. It is impossible to change the safety situation without changing the public transport situation in Uganda. And that's a reality that we actually are discussing with ministry and other partners, and that's something we must answer to be able to solve road safety in Kampala, but also in Uganda as a nation. That's something that we need to raise to our parliamentarians. If at all anything is urgent on the road safety agenda, it has to be public transport and mass transit. Thank you very much.
Thank you, Roland. I never received any question, but I would conclude by saying WHO says Africa has about 1% of the world's vehicles compared to the developed world. And yet, it's the continent that registers the highest crashes compared to countries, compared to the developed world. So what does this imply? It implies that road crashes should be, specifically from the Ghana context, should be considered a pandemic, like we saw during COVID. There were very few cars on the road, but Kanara will justify that there were still registered crashes. That also implies that as drivers, we need to watch our behavior whenever we are on the road, and that will also mean that from a government perspective, when the late Aponye died, the speaker convened a meeting from nowhere, and she gave a directive to, I think it was police or Ministry of Works, to take away broken down vehicles off the road. And since then, several other incidents have since occurred. So as opposed to making strong statements, political ones at that, when someone big has died, and God forbid, I'm not down here as I head home, and nothing is said at all. So at the end of the day, we are all equal. So let's embrace this as a bigger problem that we all should aim at preventing, from government down to the wananchi. I thank you.
Thank you very much.
Thank you, Kanari. I just want to address one specific question that I found very important. The border industry unfortunately feels that trainings must be structured by government. So you asked why the UDISA training stopped. UDISA didn't stop training border borders. It's still training. It's in its facilities. We have more than 15 driving schools that are actually training border borders in their facilities. I suggest that, because this was a tailored intervention, and it was not going to be available at all times. As Irina said, yes, this will be rejuvenated. However, those schools still train, and they still have the capacity to train. Please inform all border riders that it is important to train. Even if that person has a permit, got it in any other way, they should really look at the way they are driving and either go for refresher trainings, but they must utilize the facilities that are available. To the general statements, let's use the synergies that we have here. All of us have a forum before which we can pass on a road safety message. And the biggest forum that we have is our homes. At home, you're not going to tell a child what to do. You're just going to show that child what to do. If you leave your vehicle and you drive without a safety belt, you're not going to tell that child to put on a safety belt. They are seeing what you're doing. Mm-hmm. And if we don't pass on that knowledge today, those children will be a bigger problem tomorrow. Let us use all the available forums that we have to support the road safety cause and inculcate a safety culture. Thank you very much.
Thank you so much. I'll respond equally to some of the issues raised and make it as quick as possible. The first question or issue raised was on eye testing. Why is it only public drivers? We are not saying it's only the public drivers, but the starting point. The starting point, because the statistics as regards road traffic injuries when it comes to by vehicle type or by user, I think public transport drivers are rating quite high. And also the magnitude of the risk, because you're carrying, if I'm driving, yes, I can cause an incident to a bus as a single driver, but you as a public transport driver carrying over 70 passengers, and with all these comorbidities with you, diabetes, you visual issues, it poses a bigger risk. In a resource-constrained environment, we prioritize, but definitely law covers everyone else, each one of us here. Then, in issues to do with follow-up on admissions at Mulako, that one was answered as per the standards of Uganda by my brother from UPF. The other interesting question that I had was standards for the ambulances. This is quite very, very interesting. The issues that you're raising are the same issues that are raised by the list of the population down in the community. The issue of standards of ambulances, and this we have addressed as Ministry of Health. We currently have national norms and standards for ambulance vehicles in Uganda. And in those standards, we have clearly stipulated what an ambulance vehicle is and the different types of ambulances that we expect on the road, and in terms of the equipment that should be on each of these ambulances, plus who is supposed to man these ambulances. Just a hint, because of time, we need to go for lunch. The standards clearly show that we have type A, type B, type C. So type A are those worn out, that we those that are no longer roadworthy. Some of the ambulances you may find on the road that are empty, but sirening around. There's no human resource, qualified human resource on board to handle the victim. I've also seen an ambulance that even has no stretcher. So when I asked the driver, he told me, for God's sake, maybe we use a mattress. We use. Those are the type A that we are taking off the road in principle. Then type B are basic life support ambulances, where you're able to access basic interventions to resuscitate you, to sustain your life as en route to hospital. Then type C, as per those standards, are the advanced life support ambulances. Those can also be called ICU ambulances with advanced equipment, where, for example, you can be intubated. There's an automated external defibrillator on board. The heart can be restarted in simple language, So those are the types, but we also have marine ambulances. You've seen government has procured and deployed in hard-to-reach areas. Then aeromedical ambulances, the policy or the strategy has guided that at least let the country start with 4, because they are quite expensive. But as we speak of now, we are in the process of acquiring 2, at least. Normally those handle mass incidents or mass casualty incidents and also hard to reach areas. We also have motorbikes for paramedics. If you've been in some of these countries, those are the first response bikes that get on the scene to stabilize as the vehicle comes. So those are the standards. The issue to do with parliamentarian ambulances that procured by our brothers from parliament, we do not want to disregard them. We didn't have anything. So we are appreciative that they came in at a time when government didn't have anything. The need is we need like 504 ambulances. And that is a bare minimum. We are using a ratio, a bare minimum ratio for low middle income countries of 1 ambulance per 100,000 population. Yet international standards should be 1 ambulance per 50,000 population. But there are some developed countries that are having 1 ambulance per per 30,000 population, 1 ambulance per 15,000 population. In Uganda, we are saying let's start with 1 ambulance per 100,000 population. But even those that we have acquired, 225, do not match the bare minimum that we have set to start with. Because we need 504, we've procured 500, we have procured 225 ambulance vehicles. So members of parliament, we are appreciative. Maybe our plea, like we have always indicated to you, each time you're procuring an ambulance, some of you have reached out to us actually to guide on which ambulance you should be procuring for the population. But nevertheless, you're only assisting, that is the mandate of government, and I know government has already embarked on that journey. You can see from nothing, just simply, I told you when it comes to EMS. Now, when we started this journey of emergency medical services, when 2016, we had 2% cases that reach the hospital in an ambulance. Then later, as we advocated, we got to 9%. As we speak of now, we are at 11%. What we are telling government is, at least in terms of health regions, let each region have at least 20 to 30 ambulance vehicles minimum. Today, I think some regions are getting to 10 ambulances, but it is still very inadequate looking at the disease burden. And I've already told you, as corrected, RTRs, for example, as one of them, are contributing a fifth in line when it comes to the burden of disease as per the report of the health sector of the last financial year. Now, I will not dwell much on that. I'll also proceed to the other issue. My brother from the border industry, who mentioned the 400 to 600 dates. Those are admissions, and it's a sample from just Mulago. You know Mulago is known. There's even a border ward. You know it, my brother. Because majority, 45% of those admissions are trauma, and 90% of those are border cases. So that's where we have issues. And you had issues, of course you are concerned about financing. My brother from School of Public Health has pointed out the issue of motor third party. It comes back to the House. Parliament, we are going to come back to you. They've engaged with us. Uganda Insurance Association has engaged with us, and there seemed not to be a leeway because we were asking from them a percentage of that motor third party to go towards funding for these medical bills, because you've had the tenfold of neurosurgical cases. Someone can't afford 10 million, neither can government afford the 10 million. You know what is in the basket. Maybe taking you back, because I want you to go satisfied with data. The previous financial year, government funding over 3.6 trillion amounted to 25.6 of the funding that we had as the health sector. And out of pocket, that money that you pay when you go to a private facility was 29%. Now, 45.4% for the totality of the funding to the health sector was from the development partners. So you can imagine, 7% is the only share that we got from the consolidated fund of government. So meaning much of our funding as Ministry of Health comes from development partners. Government only contributes 25%. A brother of mine here was telling me that it is vice versa in Ethiopia. Most of the money that goes to the health sector actually comes from government in Ethiopia. But here it is from the development partners. So members, yes, I'm winding up. Now, as I wind up, let us rally on information sharing, more support to data systems, but also we are coming back with more requests to Parliament as regards policy, the Good Samaritan law that you have indicated, Doctor. We also want the EMS Act. Maybe that one will force whoever is irresponsible to fund emergency medical services, because you can see the burden.
We are glad that in terms of communication, you know, my brother from the border industry, when you talk about training border riders, it's not enough. Training you and giving you skill is not enough to enable you access care. We need to have a communication system. We have secured a 912, or we secured it from Uganda Communications Commission. That is a short code. So where you're able to call in case of an emergency. We are operationalizing it soon because currently we have secured funding and we're establishing the National Call and Dispatch Center that is going to house this 912. So members of the public can call wherever they are, whether you have connectivity or airtime, you don't have airtime, or you don't have whatever it takes, but you can be able to at least access emergency medical services wherever you are. So we are establishing a National Call and Dispatch Center and 5 regional call and dispatch centers, plus the software has been secured to be able to operationalize the 912. I think that will enable us move forward as a country as we mobilize more resources to invest in emergency medical services and the entire multi-sectoral approach to road safety. Thank you so much.
We're going to go for lunch, but I thought we should sign this commitment board. And just to remind you, as you exit at that desk at the exit, there's your coupon for lunch. Lunch will be in the hall just right there. You'll be told where to go. Let me invite Judith Carrara to take over this session for signing of the commitment board quickly. And as well invite the following people to the stage. Honorable Alex Ruhunda, Honorable Boker, Esther from SEPA, Sacho here, the representative from SDG Secretariat OPM, SP Kentaro, and all representatives from Ministry of Works and Transport, Rosaku representative KCCA, I see Jemima, and Academia, Makere, and then the Ride and Drive Associations come here, do this iconic picture of signing of the commitment board, and then launch. Judith. This is for World Remembrance Day of Road Crash Victims. There is a blood donation exercise for road crash victims in Uganda taking place today at the Uganda National Mosque, Old Kampala. It started as early as 9. So you're invited to go and donate blood for the remembrance of road crash victims. It is very, very important that you do. Today it's me, today it's you. You never know when it's your turn.
Thank you very much, Canary. Ladies and gentlemen, thank you very much for being with us. I am not going to take long. And thank you, SEPA, for this initiative. Rosaku, our dear stakeholders in the House, thank you so much. Our dear MPs, for always being with us, for always supporting road safety and talking about it whenever you have the opportunity. May God reward you. We are going to sign the commitment board like we have been guided. Let's start with ourselves. So we are writing here, you know how the churches say those who want to get born again, come to the front and say these words after me. So we are going to do that. Individually, we'll be led by our honorable members of parliament, and the chairperson, Pafros, is already here. So we are going to take the commitment that I commit on my own behalf to champion road safety, to drive safely, to demand that I'm driven safely. We have talked about principles with your drivers, to demand that I'll be ridden safely on a border, and that's very important. If we came out as passengers to speak up and demand for our right to safety, then maybe there would be sense among the drivers on the road, especially with motorcycle riders. So if you let your rider take a wrong lane, if you let your motorcycle rider drive you through a one-way, then it is on you. So let's take the podium led by the chairperson, Pafros, together with the Honorable Member of Parliament, Honorable George, Dr. George. Please get the markers and sign. It will be followed by the chairperson for Rosaku, as well as the leadership SEPA, and then the team on the podium, led by Afande Kananra, will follow. To please put your signature, and let it also be in your heart that from today I will not drink and drive. From today I will not speed above the limit, and we shall be careful on the road. Maybe if it starts with us, then we shall also teach our children, and we shall talk to our friends, and then the message will go on and on. So the process is going to continue. We thank you so much. We apologize that we've taken your time, but also we are within the time of the set program for the day. So after this, we can have our lunch and depart at leisure, I guess. So who is signing now? Yes, OPM. Okay, so please put your signature and the initials of your organization. So MOWT, Truck Drivers Association, Bus Operators, Border Industry, taxi drivers, like that. So we are going to move the board to down, just a step below, if I could be helped by the SEPA team. So after you have signed your commitment, please proceed to pick a coupon and have your lunch. Thank you. Yes. Our meeting is going to end with lunch. We thank you so much again for coming, and we invite you also to join us on Sunday as we remember the road crash victims over the years. And we remember and pray for them, but also commit again and again not to do what would kill us. So please join us on Sunday at Chambogo grounds. Oh, I'm told that there will be a group photo, so please allow the camera crew to guide us on how to do that. Maybe we will do that before we go for lunch. So let's stay calm and we'll have the photo. Thank you. But we thank you so much again.